Good morning, everybody. Welcome to this meeting of the Food Standards Agency in Liverpool. I'd like to ask Nikki Elliston to introduce our housekeeping matters for today.
Thank you. Good morning. Can I please remind everyone at the table to switch off their mobiles? There's no fire drill scheduled for today. In the event of an emergency, there's 2 staircases leading from the conference floor to the ground and lower ground floor. The fire assembly point is outside the BT Convention Centre, which is just across the way, and staff will be available to help guests. Thank you.
Thank you. I'd like to remind people attending the meeting that you're here as observers. There will be an opportunity for questions immediately after our board meeting has concluded. If you're joining us via the web, there's information on how to ask questions on our website, and you can pose questions to the board via social media using the hashtag FSA Board. I'd like to remind board members of the need to declare any relevant conflicts of interest before a discussion item, and I'm not aware of any items of other business, but are there any AOB items board members wish to log? No, good, thank you. I turn to the minutes of our last meeting. These were circulated to board members informally to comment. Before we finalise them, are we happy now to agree that those minutes are an accurate record of our meeting? Thank you very much. And matters arising from the minutes. We've got a table of the actions to follow up from those minutes. Anything that board members wish to pursue there?
Not on the actions arising, but item 27 in the minutes refers to the independent external review of the acrylamide campaign, and just wondered when that was likely to be available.
So that's a review of communications following the acrylamide campaign, and that will be with the Chief Executive shortly. I believe he's finalising it at the moment.
Yeah, we've had the initial draft report, and we met with the reviewers, Julie and I, 2 weeks ago. We've sent our comments into the review team, so I would anticipate we've got a final report within the next 1 to 2 weeks, I think.
Anything else on the actions arising? Thank you. A report of some of the things that I have been involved in since our last board meeting, and there'll be a full list of engagements that I've undertaken on the website. I've only had one ministerial meeting since our last board meeting because of the general election and the PERDA consequences of that, but I did have an introductory meeting with Lord O'Shaughnessy, who's the Parliamentary Under Secretary of State for Health in the UK, overseeing health matters in England. He continues in that post, so that relationship will pick up after the Queen's speech today. We've also, in pursuing our relationships with departments across the 3 countries in which we operate, I've met with several representatives of the Department of Health, including Dame Sally Davies, the Chief Medical Officer, and Clara Swinson, who's the Director General for Global and Public Health. And last week I met with Richard Pengelly, who's the Permanent Secretary for Health in Northern Ireland, and with Noel Lavery, who's the Permanent Secretary for Agriculture, Enterprise and Rural Affairs in Northern Ireland, meeting with them in the absence of ministers being in place in Northern Ireland at this point. All very constructive discussions and meetings, aligning our agendas and making sure they were fully cited on the priorities and activities of the FSA in their relevant countries. Jason and I also had our regular 6-monthly meeting with Food Standards Scotland with their Chairman and Chief Executive. It was a really constructive meeting, and I think we've strengthened the close working relationships that there are between the 2 organisations and the alignment we have on key issues, including how they're involved and we're involved with them on regulatory reform. I chaired an interview panel for the appointment of non-executive directors to this board, and that has reported into ministers, but that process was delayed by the general election and by PERDA, so there has been some delay in appointments progressing there. Jason and I again had a series of meetings with representatives of the veterinary community, the Royal College of Veterinary Surgeons, and them separately with the British Veterinary Association. And I've also met with Nigel Gibbons, the UK's chief vet, where we've talked about matters concerning animal welfare, the delivery of official controls, and the veterinary workforce that we have in the Food Standards Agency and more widely in the industry that we work with. We've been talking a lot around this table about regulatory reform. In pursuit of the Regulating Our Future programme, we had a very constructive meeting with Lord Lindsay, who chairs UCAS, UK Accreditation Service, and some of his staff, talking about the contribution that they can make in terms of accreditation and assurance for regulatory systems. And we've also met again with Jason, Leslie Ann Nash, who leads on regulatory futures for the government from the Cabinet Office. And it was really heartening to see the view there that the Food Standards Agency is taking a leading position on improving regulatory approaches and the regulatory regime. And finally, a series of industry events. I delivered a speech at an annual food industry dinner for Walker Morris in York in April. I've met with Ian Wright, the Director General of the Food and Drink Federation, with Norman Bagley, the Company Secretary of AIMS, and with Adam Leyland, the Editor of The Grocer. I visited Two Sisters plants in Yorkshire in late May. Particularly interesting there to talk about Campylobacter and progress on that, and also followed that up with discussions with Moy Park on Campylobacter and their progress, all starting to reinforce the measures that have been taken by the producers in tackling Campylobacter going through into the retail sector. And we, again with Jason and with other members of the executive, attended the Food and Drink Federation dinner last week, and I delivered the annual Camden BRI lecture a couple of weeks ago on the coming of age for the Food Standards Agency, and that lecture is available on our website. And then the final thing to report is that Guy and I had the chance to attend the first meeting of the Science Council last Friday, a really constructive meeting, took part for most of the day. There was a nice attendance in the audience as well from interested parties, particularly people involved in technical work in the food industry, as well as academics, some media interest. The Science Council got together, I think, in a really constructive frame of mind, clearly different from what we've had before in terms of the GACS committee. We posed them 3 initial exam questions, and you'll see those when we come to the paper later on the agenda on our future approach to risk in the global food system. But the Science Council, I think, are well seized of the importance of their contribution to us. I thought had a really wide-ranging conversation, got to the heart of some of the issues really quickly, and understood the reasons we were asking the questions, which is also, I think, really important in terms of us getting input back, which is really actionable. So that was a really constructive first step. Just a couple of other things to note, that in the birthday honours, a member of the Science Council, Professor Laura Green, was recognised, and also Professor Chris Elliott was recognised in the birthday honours, both of whom with connections to the Food Standards Agency. That was all that was a long list actually, that was all I was going to mention. Anything on any of that, any comments or questions from board members or anything else to do with the chair? No, in which case it's my pleasure to hand over to Jason to present his first Chief Executive's report.
Thank you, Heather. And colleagues will be delighted that I'm not going to work all the way through the 51 paragraphs, paragraph by paragraph. You'll see that I've laid the report out in key areas around engagement, our people, change delivery, science, and the crime and legal work that we're engaged in. Draw your attention particularly to the work we've been doing with our people at paragraph 6, really to make sure that everybody within the organisation understands, is aware of and focused on the priorities that you as the board have set the organisation. And I was very keen that we do this face-to-face and give everybody in the organisation a chance to have that open exchange and ask questions of clarification or challenge. So that we're in a position where everybody understands what's expected and why we'll be setting the framework for why we'll be taking some of the decisions we're taking over the coming months. So these will be a regular feature as we go forward. And initial feedback is very good. People enjoy the opportunity to meet directors. Directors are doing it in pairs. It gives an opportunity for those that don't often see other directors to have that exchange with them. And it's all about engaging our people. It's their most important asset, and we won't deliver anything without having everybody on board. So we put in a lot of time and effort into that over the past few weeks. So next round in September as well. And then just draw your attention to the continued development of FHRS. Paragraph 20 in Northern Ireland and Wales, where we're continuing to develop the scheme, add additional features to the scheme, and make the scheme more relevant to how people are ordering and consuming food. So, like being able to put it online with clearer information available to consumers. And lastly, just on the engagement piece, Heather has outlined a whole list of engagements that she's done or we've done together. That's a continued and conscious push for us. So in addition to what we have listed here, we're both meeting with the BRC tomorrow at a seminar that they're running. I'm back with the FDF on Monday, meeting industry reps several times a week. So really helps us in terms of shaping our thinking on regulatory reform, but also as we prepare for the UK's exit from Europe. And we are taking views and consulting widely on that.
Any questions for Jason? Ram and then Paul.
Yeah. Firstly, to say how much I've enjoyed reading your report, Jason. Very thorough, very clear, and very helpful. The point, I wasn't sure whether to raise this after your report, Chair, but this was to do with the meeting with Scotland and regulating our future. And I raised it here under item, I think, 12, 13 onwards. Are there broad similarities in terms of the framework they're following and the rest of the nations are following? Is it a similar direction of travel or something completely different, just to understand where they're coming from?
No, it's very similar. What we're trying to make sure is that we're not both trying to reinvent the wheel at the same time. We're trying to make sure that we are exchanging information and insight, learning from each other. Because they're smaller, can sometimes be a bit quicker, a bit more nimble than we can be sometimes. But obviously, we're mindful of the fact that it's helpful to have as common a system and a greater alignment between all four countries within the UK as we can possibly manage and deliver, whilst recognising Food Standards Scotland's independence.
Of course, no, thank you for that. Just wanted clarity on that. Do I go on with my points, or would you? Yeah, the next one is to do with the efficacy of recalls project, item 16 in your report. Again, very good to see that progress has been made there. The interim findings, I know we'll get the final report in September, but any chance of seeing interim findings before that, or is the plan?
And we could put something in the weekly update to the board,
okay,
in terms of headline numbers. As you say, it's coming back to the board in September. I mean, I think the thing for the recalls project for me is, whilst it's felt as if it's taken some time, and the reason it's taken some time is because we've been undertaking specific research so that we know that when we decide what the appropriate actions are, then we're targeting our capacity and expenditure and effort at the right elements of the system. And so, there was a dearth of information and intelligence available to us when we decided we wanted to do something significant about recalls last year, and we've undertaken that research. So I'm confident that when we have the action plan, it'll be targeted at the things that will make the most difference.
Excellent, thank you. Next point, Campylobacter. Really good to see continued progress there. The question I have on Campylobacter links in later on to the chemical contaminants paper. It's a question of resourcing. Given the campaign has been so good, and over these fourth year now, seeing the resources put in and the priorities been given, and the fantastic results that are following, as that improvement continues, to what extent is there scope for rebalancing resource allocation? So I was trying to understand where chemical contaminants resourcing, how that compares with others, the other needs within the organization. Is there a case that resource expenditure will reduce in Campylobacter? Will it continue at the same levels? What's the
I think I'll bring Steve in a minute, but we're already doing that, Ram, in terms of recalibrating our effort. And we're consciously not putting the same amount of expenditure and capacity devotion to Campylobacter as we did 2 years ago. That said, we're not walking away from the issue, because we want industry to continue as they have been doing, stepping more into the space of driving this themselves, and continuing with the innovation and the development of new approaches and new techniques to try and drive it down even further. But this is something that we need to keep our eye on, given the nature of it and the extent of it. Steve, I don't know if you want to add anything.
You're absolutely right. So over the past couple of years, we've been significantly reducing the programme expenditure, so the amount of new science and evidence we seek and fund in Campylobacter, because it's a mature and well understood area. Useful though that the Oxford Martin School will be undertaking a restatement on Campylobacter, which will provide us with a good, up-to-date, independent assessment of the quality and nature of scientific understanding in the area. So that will allow us to take further decisions on what and whether to invest. In terms of the number of our people involved, that too has been reducing, not to zero, because when the board last discussed Campylobacter, we agreed a programme of interventions to keep up some pressure on the industry and to bring down levels of Campylobacter in chickens from the smaller producers to hopefully an equivalent level that's been achieved in the larger producers. We are redeploying that work most significantly to policy analysis that's needed to support the work on the UK's exit from the EU.
Item 20, sorry, my eyes are, it's 27, where you talk about the new functioning surveillance system. Very interested to see that the programme will provide the FSA and other stakeholders across the food system. Is this then open to all and any stakeholders to come to us? How will that work out? Is there a targeted range of stakeholders who we approach with this kind of information? Just wondered what the plan was.
Thanks, Ram. It's very early days. We've got a session on it later on the agenda as well, which will go into more detail, I guess. But there are a range of stakeholders in terms of developing our thinking about what the key components might be and what the data sources might be. Again, Steve, do you want to add anything?
Thank you. Yes, so we're in the stages of creating an external stakeholder group, a reference group to help provide inputs. One of the main reasons, though, why we talk about providing us and other stakeholders across the food system with novel insights is the thing we're really interested in is not just a better understanding for the food system, although that's helpful, but generating actionable insights. When Guy has talked previously about the data pyramid and the top of that being action, that's what we're focused in. And we recognise that where our surveillance identifies the need for action to be taken, it won't always be us that needs to take the action.
The other one is 29. This is more a detail, but market share data. Is this something that the National Statistics Society produces? What market share data do we use? Because I've seen so many different market share data in the market, and I just wondered which one the Food Standards uses in terms of market share data.
I don't know, to be honest, Ram. I'd have to check.
Okay, just wondered, because just to say, as a warning, there's so much out there, and when you base your decisions on one particular one, it's interesting to see which ones you're using. I mean, you can buy these, of course, and the more you pay, the assumption is the better the data, but I'm just intrigued as to the resource implications here.
And I'm looking around colleagues and I'm not getting a hand saying
okay.
that they know the answer,
problem.
so we'll all have to take it away.
Okay, no problem, sorry. And the next one is the, let me just see my sticker. It's the timeline. Yeah, this is the one on all results from the survey will be published in the final AMR survey report. Any found exceeding legislative food safety limits or those of significant concern in relation to public health will be notified to the FSA and brand owners. And I just wondered, in terms of the timeline there, you get your results later, the tests are done, and in the meantime, the health risk to the consumer is in the marketplace. So it's just in terms of what the delay is, how quickly do we get that information to really curtail?
I couldn't tell you in terms of days, but clearly, if we had a result that breached those levels, then we'd be responding immediately. So, within the 24-hour period, once you've got the result, I'm not au fait with how long it might take us from taking the sample to getting the final result from the lab, but I would guess it's going to be a week or 10 days.
Sorry, I have a few points. I said I really appreciated reading the report, and it raises questions for me, which for clarification. Number 34, the Chief Scientific Advisor's report on data science. I thought it'll be really good to have examples of all this in practice, where it talks about, and by the way, it says against the 6th CSA's report. It's the CSA's 6th report, but this enables FSA to predict areas of risk and vulnerability, which in turn help inform appropriate intervention strategies. And my question here, I hope I can remember it. Yeah, is to have examples of what this means in practice. How does this work out in practice? Are there any examples, not for immediately, but for future, just in terms of what that means? And I think I have the last point here. Yeah, this again for the Chief Scientific Advisor. The number 35, it talks about a comprehensive review of emerging risks using technologies such as sensors. Now, my knowledge of these sensors is I know that Tesco's, for example, is a great user of nanotechnology. How prevalent is this new technology within the sector so that we really get balanced information? In other words, we're using the technology there, and then we've got, yeah, I suppose it's the same as before. Again, what sort of examples do you have of how this is affecting the decision-making within the FSA?
Okay, you want to take that?
Okay, thank you very much. The examples often are found in other sectors, and that's why we're actually working hard with some of the external organisations that are in this space. So, for instance, as you know, we have a fellow based in the big data world at University College London, and the specific examples in the food sector, we've given some of them, and you'll hear some more later, actually. Julie and Sean are giving a talk, which will actually give you some real-world examples, exactly what you're asking for, later today. The other interesting opportunities in that space is that the financial sector are quite advanced in using a whole range of these techniques, and I know that Heather's been written to, for instance, by the chair of the Lloyd's Registry Foundation, which was something which came out of our Science Council meeting last Friday, who are keen to work with us in terms of using the techniques used in Lloyd's risk insurance in terms of our sector. And I think that will be fascinating and offer lots of opportunities too. You also mentioned sensors. This is within the area of what you probably read about in the newspapers and at times is the Internet of Things. This is the fact that it's very hard now to have any piece of equipment on you personally or in your home which isn't sending loads of data elsewhere. And the real opportunity there is how we capitalise on that data. So you mentioned industry. We have started working with some of the big retailers who are sensing temperature conditions in terms of their delivery chain. And that enables you to actually make quite subtle but important changes in terms of perhaps predicting how microbes might grow, because you assume that temperature will be fluctuating and therefore the microbes are growing very fast, which might determine exactly what use-by date you put on a product. If you know using sensors that from the moment it's been picked to the moment it ends up on a shelf, it's been kept at a very low temperature, which the sensors can assure you of, you have the opportunity to adjust use-by dates potentially, which obviously could be very important in terms of reducing waste, as an example. The other types of sensors, as you probably know, are the sensors which you could actually have placed in products which change colour when you see microbial growth or chemical contaminants. And these things are all out there. One of the big challenges in our space is one's dealing with often a very high volume, low profit commodity, and therefore you've got to get some of these sensors at a price which makes them kind of a realistic thing to do in our sector. Whereas, you know, obviously in things like the engineering sector now, your car is constantly using sensors to kind of feedback mechanisms, etc. But obviously trying to incorporate that technology in a food product which is only worth a small amount of that money is a challenge, but I think it will happen.
Heather Peck isn't here, so I need to ask this question on
okay,
animal welfare.
But then we do need to bring some of the people in round. Thank you.
On animal welfare, I was very pleased to see you deter, prevent, detect and enforce. And I just wondered how that's being measured. When we say something like achieving positive results, are there plans in place to measure this so we can report back improvements to defend that kind of statement and show that we really mean business?
Yeah, and you'll see in the summary report for the and the summary element of the performance report in the business committee later, it draws out some of those metrics and shows the reduction that we've seen in enforcement measures that we've had to take, so therefore improve compliance on animal welfare issues.
Thank you, Chair. And, I know it was a long list, but thank you very much.
Paul.
Thank you. I'm afraid there's only one. Which is point 36. We're talking about the review of the risk assessment processes, functions. And it seems to me the way the FSA does risk assessment for chemical microbiological risks is quite an important area. And I don't know quite what level this review is at. But my question is, would it be, or could it be appropriate for the board to have a view of the report and comment on the recommendations? I don't want board stepping in, obviously, to operational areas, but it seems that this may also trip into some of the sort of strategic areas of how we handle risk.
I'll bring Guy in on that.
Yes. So the review is being undertaken by Paul Leinster, who was the Chief Executive at the Environment Agency, and has done a number of reviews of a whole range of risk assessment organisations across the country. So we're very pleased that he agreed to take on the role. One of the things which we are looking at, which certainly would come back to you in terms of your input, is the functions of risk assessment which we currently do. Some is kind of the rapid risk assessment which you need to undertake in a 24-hour type period so you can make an initial decision. Secondly is the sort of, shall we say, the more medium term looking at how we do risk assessments, feeding into some of the European currently or the global bodies that oversee some of these things. And then the third is actually, shall we say, the more sort of longer term aspects in terms of whether new risks are coming along that we're going to have to modify how we work on systems to look at. And clearly we come from a world in which largely the Food Standards Agency conducted all of them themselves with some external input, and we're obviously interested in whether that's a sustainable model moving forward and whether it may be a better place in the future to have a core team within that do the very rapid side of the work, but perhaps a more contracting out to expert audiences and input from for the longer term aspect. Now this is just all for debate, and the review is going to look at where we are, where other organisations may be, and offer a whole range of scenarios which we can consider. So that's when I think it'd be really important to have that conversation.
It also, though, it's absolutely something for the board, to my mind, because that's one input. Obviously, there'll be Guy's expert advice as well, but we've asked the Science Council also to look at two relevant questions. We've asked them to look at our science capability and capacity, and where we get that from. So the same way, not begging the question about is it in-house or out-house, how do we make sure we've got the right capacity and capability? We've also asked the Science Council to give us a view on what best practice looks like in establishing and communicating risk uncertainty. All of those things, I think, come together for us to be sure about what the right mechanisms, structures and resources might be, as well as what the right policy approach and position might be on risk uncertainty. Stuart.
Just one. EMR surveillance study, are we going to look at imported as well as home-produced product in that study?
Steve, do you know?
Yes, it looks at retail. It takes samples at the retail level and aims to be representative. So the sampling grid will represent the full range of products available to the consumer at retail, which obviously will include imported product.
Any other questions or comments for Jason? No? In which case we'll move on to our first paper in front of us on the principles on chemical contaminants. Are there any declarations of interest on this paper? In which case I think we're going to be joined by Mark Willis, who's our Head of Chemical Contaminants and Residues Branch. Welcome, Mark. And Steve's going to introduce the paper.
Thank you, Chair. I'll be brief because the paper hopefully stands on its own merits. It struck us, though, in preparing this paper that this is a relatively rare opportunity for the board to discuss chemical contaminants and how we manage those risks in the round, rather than just focusing on one or other of the chemical contaminants of concern. And so in this paper we've attempted to communicate to you and others who may read it some of the complexity around the variety of risks that chemical contaminants might pose, around the assessment of risks which do tend for chemicals to be chronic rather than the acute risks that we see with microbiological contamination of food, and set out how that poses challenges for both risk management activity and for risk communication. But the two main areas I'd suggest we're bringing to the board for discussion and decision are firstly around governance and decision making. We've set out how it currently operates at global, regional and national level, and at national level we are proposing to formalise the respective roles of the board and executive, and you'll see that in sections 3.2 to 3.4 of the report. And this is the first time in which we've tried to put down on paper and formalise and draw the distinction between the roles of the two different parts of the organisation. And the second area we're bringing to the board for consideration is setting out, it's the diagram on page 6, the principles that we apply to risk management implementation within the executive, asking ourselves the sequence of questions: is intervention needed? If so, would advice or guidance to industry or consumers be sufficient to help manage the risk? If not, should we look at alternatives to legislation, so different types of regulatory intervention? And if we think those aren't likely to be impactful and effective, only then turning to think about legislative change. So that hopefully frames and informs your discussion and gives you a pointer as to the areas where we would find input most helpful.
Stuart.
Just to kick off, Stephen, a point of clarification. I mean, it is a really important subject, and the reference you made to the dioxin scandal several years ago highlights how important it is to look at it. But I just have a little bit of a struggle trying to put it into context in terms of resource with the likes of the Campylobacter campaign, because there's not much information in there that indicates how big a risk it is and how we might resource it in relation to other things that we've got to do.
I suppose looking at chemical contaminants, the range of chemical contaminants that may be present in food is so wide. You're looking at probably a broader range of potential risks than you are with microbiological contamination, where there are a small number, a handful of well-characterised microbiological contaminants of food in which we're interested, although that list is growing, particularly the addition of new viruses to the list of things we're concerned about. But the list of chemical contaminants of potential concern is absolutely vast, and so it's a different type of regulatory activity. It's identifying from this broad range of chemicals from a range of different sources, some man-made, some geochemical, some that occur spontaneously during processing, trying to identify which of those are worthy of regulatory intervention, which pose a significant risk. So it's rather than focusing in depth on a limited number of contaminants as we do in microbiological safety, we're really scanning a broad range of potential contaminants to identify those where intervention may be required. And so it is difficult for that reason, for the breadth and complexity of the issue, and for the fact that we're talking about chronic rather than acute risks to compare microbiological and chemical risks. I suppose there have been some attempts to model, but they are just models. The impact of chemicals on health endpoints. There was a review by the World Cancer Research Fund a few years ago which suggested, for example, that up to a third of cancers may be related to food. But that's not just chemical contaminants, that talks about obesity and overnutrition and a range of other risk factors in food. So even that, which is one of the more wide-ranging attempts to look at risk, isn't specific about risks from chemical contaminants. There are some that are well characterised. Lead, arsenic, for example, the potential health effects are well known. For some others, which have been where there have been high-level human exposure as the result of food adulteration or chemical incidents, we have a better handle on how exposure gears to risk. But for the majority of these, we are reliant on risk assessment that looks at high-level exposure in animals and tries then to extrapolate what the effect at low dose in humans might be. So as I say, a very different set of dynamics than microbiological contamination, but important nonetheless, and just as important a part of our regulatory function.
Guy, did you want to add something to that?
Yes, I mean, it's a question that many people often ask in terms of, how many cases, how many people, so therefore can we judge this with, one of the other parts that we do. And as kind of Steve was discussing, the fact that often these are sort of lifetime chronic exposures, it can be very, very difficult to do that. So this is where actually our increasing discussions with organisations like the Health and Safety Executive, who have a lot of work in this space, are becoming very important to us. Not just in terms of how you go about developing new methods or thinking about this, but coming back to the risk communication side of things, in which the Health and Safety Executive often deal with very sensitive issues and are trying to manage people's concerns accordingly. To give you an example of these are challenging, but yet again very important, is you probably hear figures about how many people are being killed by air pollution currently, a figure between sort of 20 and 30,000 people. But actually, when you delve into it, it's actually it's lives equivalent lost, and not actually that specific number of people dying, which becomes quite difficult, because you do struggle to say this event caused this person to die or become ill. So I think one of the things that we can offer is that the working with other organisations is actually advancing things in a more rapid fashion than was the case before. And obviously the Science Council, we had a discussion in this space too, because when it comes to prioritisation, it's very easy to prioritise if you can turn around and say which is the biggest number of people being affected. But as the consumer choice work here talks about, in terms of people's perceptions or fears of things, they sometimes fear this more than a microbiological risk, so you have to consider that in terms of perhaps where you put your priorities.
I've got Paul, then Ruth, Ram and Rosie. Paul.
I think the central bit of this for me is the set of principles, which I really like. I like how they're laid out. I think that's very clear. My issue that I want to bring up is that I think there might be something missing there, and that isn't really caught in the rest of the paper, which is, particularly with food, we're very often not considering risk and isolation. We're actually considering a balance of risk and benefit. So, to speak from personal experience, something I worked with the FSA on before I came on the board, was the advice to pregnant women on fish consumption, where both FSA and FDA in the States had to wrestle a little bit with the balance between the risk in pregnancy of dioxins and mercury in fish and the increasingly well-documented benefits of omega-3 to the developing embryo. And I think that's just one I know of. There must be in food quite a lot of cases where it isn't simply a question of there is a risk. There is also a need to balance that against a benefit and try and come to some sensible advice. So just maybe a comment on how we capture that and whether that is brought into the principles that we're talking about.
Steve?
Thank you. I was just discussing with Mark that example of advice we gave some years ago now on fish consumption, which, yes, was related to levels of dioxins and methyl mercury in oily fish, is still the exception rather than the rule, because we brought together SAC, the Scientific Advisory Committee on Nutrition, and COT, the Committee on Toxicity, to try to balance those risks and benefits. What's more common in terms of assessing what an appropriate risk management approach is understanding what the unintended consequences of advice might be. So, for example, if we recommend people not to overcook food, that's something that we've recommended in the past due to risks related to benzopyrene in barbecued meat or acrylamide in starchy foods. We have to bear in mind what messages that might send, which lead people to then undercook food and expose themselves to a different balance of risks, largely microbiological, which is one of the reasons why I said, and maybe didn't give enough detail in my opening comments, that risk communication around chemical contaminants is often complex, because you're looking at providing advice which might lead people to change the balance of their diet, as in the case of fish, or change the way they store or prepare food that might introduce a totally different set of risks which may be larger in magnitude in the end. So yes, it's not a straightforward area to work in, as I'm sure Mark would attest.
Ruth?
I welcome the opportunity to talk about chemical contamination, and the paper sort of poses a number of issues. I just want to come back to the point Stuart was raising, really, about how you assess the scale of its impact, and Guy, you illustrated how complex it is, but I think it's really important, because to make judgments about priorities, this issue of balancing the acute, immediately measurable things against long-term issues is terribly important for us to get that balance at least well thought through. I was going to say get it right, but these are all judgments, aren't they? So I would welcome, I think, any updates as we go forward in terms of how will the FSA be able to quantify human health risk in a way that helps to make those judgments for the board. That was the first point. Second point, it wasn't clear from the paper how resources are allocated to this subject area. And again, is it historical? So it's the scale of endeavour within the FSA, basically something that's grown up over time, adapted, and is there a need to just stand back and look at, again, using the sort of knowledge we have about the scale of impact, whether that balance is right across the business of the organisation. And then the third point, briefly, was in 3.2, it talks about the role of the board. It's really important that we're clear about that. I just wondered how you thought that would be enacted in practice, and what you expect to happen. It talks about FSA will make judgments and review the priorities based on emerging new knowledge and so on. How will we do that annually, or on each issue as it comes up? What's in your mind? Thank you.
I think your comments in those two different areas point towards a common need, and it goes partly to the paper you're discussing later on, Understanding Global Food Risks and Issues, partly to our work on surveillance with partners to identify new and emerging risks, because the thing that we will need to understand better to drive future activity is about what risks are emerging or new or coming to the fore. So for me, it's less about continually monitoring the balance between microbiological and chemical risks. I think it's looking at risks related to food safety in the round, and saying, so what are the things that are happening in the external environment that change our understanding of where the risks are and where resource might be needed to understand them, or where we might need to commit resource to designing and implementing new interventions. So although I myself in my comments have drawn this distinction and if like contradistinction between chemical risks and microbiological risks, it's not, you shouldn't see it as a seesaw, whereas one end goes up, the other goes down. We should look at all those risks in the round and ask ourselves what new evidence is causing us to change our assessment of where investment is needed. So it becomes less about a retrospective view and plotting where we've come from, because that would be relevant if the risks were static. But the one thing we do know is that the risks are ever changing, and so it's the forward trajectory and our ability as an organisation to identify and understand those risks and then follow through in assessment into impactful intervention that's I think the key task, and that's then the point of intervention or point of decision for the board when we identify that changing balance of risks and need to make important and impactful resourcing decisions within what will always be a constrained resource envelope. That's when we need the board to decide and help guide us on where to put those resources.
Just coming back on the when we discussed it, the Welsh Food Advisory Committee, it was a sense of, well, what's the current position? Where are we starting from? What's the balance? And it's not about microbiological versus chemical, but in the balance of the business, are we broadly in a reasonable position? Have we got the balance right across the different risk areas, not just chemical and microbiological? So it's a sense of, is that in need of attention? To make sure that we do recognise the acute versus long-term issues and the emerging risks. It's a question basically about the current position. Do we feel it's manageable as it stands?
I mean, I'll defer to Jason and Heather, but if it would be useful, we could bring as a future business committee item a picture of how we deploy our policy resource, because if you like, policy or regulatory policy is the bit that sits at the middle, that commissions the science, that then seeks to design the interventions, and we can give you a picture of how we deploy that resource amongst the various risks. And as you say, it's a judgment about whether that is right or appropriate, but it would at least identify that current stage, so that any decisions then about whether to change that resource deployment would be from that understanding of what the current situation is. And I understand, I mean, I accept that in this paper we've told you what we spend or commit to, or the resource we use on chemical contaminants, and I can tell you what that is as a proportion of our total resource on policy, but it doesn't then give you any insights as to what the other areas are.
I would rather that we didn't rush to that, because I think that is being resource-led in deciding how we're addressing the risk question. And I think we've set quite a few balls rolling in the last few months and with the Science Council, which is give us some better bases on which to make the comparative risk judgment. At the moment, and this is a conversation that Guy and I had with the Science Council last week, it's quite hard for us to compare apples and pears. And we might never be able to perfectly compare them in terms of that balance between acute and chronic health risk or changes in levels of risk, but we're trying to get to a position where at least we can close the gap. And my preference would be for us to let some of that work be done over the next few months. I don't think anyone's suggesting there's something fundamentally wrong at the moment with the balance of this. Let's let that work be done, and then we can have a discussion at the board about how are we going to make the risk judgments, and then we can apply that decision to how we have made the resource judgments. For me, that's the kind of a flow, because I think you're absolutely right. It does beg the question, but let's not answer the question on our current understanding. Let's get that other work done, and then we've got a firmer understanding for it. Guy, how would you feel about that?
Yeah, no, I mean that would be really good, and it would enable you to make a kind of an objective decision, which would be which would be useful. So, for example, whilst £367,000 relative to everything else might seem a small sum, but one of the things that we are beginning to really explore is what's the likelihood of a piece of evidence gathering having the impact that you want, so that it may well be you kind of think to yourself, if we were to double that or treble it or whatever, would it give us much greater impact, or is it best leaving it where it's having impact somewhere else? So these are the sorts of things, as Heather said, we're beginning to work through. And actually, moving forward, it is, and importantly from the board, issues to do with what your risk appetite is on various things and your willingness to kind of put in amounts of money to have either major or relatively minor increases in the impact of that money, I think will be available in a way which perhaps hasn't happened in the past.
Ram Rosie Colm.
I think Ruth, building on Stuart's point, made the point that I was going to make far more eloquently than I would have. Very clear, and communicates the issues. I suppose the fundamental concern I have is the data. Just reading 2.3, for example, in the report, when it says, given the chronic effects, very limited data on any fatalities, I'm assuming there is no statutory obligation to log chemical-related incidents, and so it's like, how are we getting this data? How much can we trust the extent of the scale of the issue that we are facing? And therefore, when we look at the question of have we got the balance right, I'm not convinced, based on what I'm seeing. Maybe it is, maybe the gut feel is right, but I cannot sit here saying, looking at this, we've got it right. My concern is, what if it is significantly more, and are we therefore allocating our resources appropriately? And just a minor point, by the way, here now, the next point, which is, it says it's the cause of 19% of all incidents. The FSA report, I think, says 12%. But were it 19 or 20 compared to the 12, now that's a significant and material difference, which causes alarm bells to ring, that if of a decision is based on the 12% figure, and it's now more, have we got that right? So that I think was sparked off by that, and the rest of the points have been raised, and I'm satisfied with the response in terms of what we allocate and all that.
Take a couple more points before any feedback from that, Rosie.
Thank you. I just had 2 points, actually. One was around the consumer communication side, which is Para 3.4. It mentions that there's been a number of projects in the last 3 years. What I'm interested in is, are we acting on the results of these bits of research? And it states that there's low consumer interest, yet we're putting some resources in this direction, and I would argue that recently there's been quite a lot of coverage of things like rice products and arsenic, and it's been mentioned about heavy metals in fish. I think that I'm not sure I'm completely convinced that there is low consumer interest in this area. I think it could be quite high, and I would just like to know how we're approaching the consumer aspects of it from the communication side, because it looks like we're slightly relying on the FSA website and NHS choices, and I wondered if a more wide plan was envisaged. That was my first question. The second question was really about what data we can get from other routes when it comes to fatalities and inpatient stays in the hospital relating to this. And I think there's a little piece missing here. It's been touched on already, so we can really be clear on what is being captured on hospital episode statistics around acute contamination incidents, and whether that is something that we should be aware of compared to, for example, fatalities of foodborne diseases of other sorts. So I think there's just something there I'd like to know more about. Those are my 2 questions.
Thank you. Do you want to come back on that collection?
Thank you. I think, first of all, on the incident side, we've put in the figure of 19. That does also include contaminants and pesticides incidents, which is why there's a slight difference between the 12 and the 19. But I think, to be honest, the measuring by the number of incidents is a little bit of a red herring, because as Steve has said, a lot of the time we're talking about extrapolating from animal studies on the risks from these different contaminants, and it's about setting levels in food as low as reasonably achievable, because we can't count the fatalities easily. A lot of the incidents we deal with are fires and other things that happen, and every single one of those, when an industrial fire happens, that triggers an incident. However, in reality, the actual issues arising from that, from food safety, are limited, if anything at all, that can be dealt with by the simple wash and peel advice. So they're triggered as an incident, but they're not actually a real incident that we're worrying about. It's not our bread and butter in terms of contaminants. A lot of the time it's more, we're more concerned when there are higher levels of aflatoxins than there should be, high levels of mercury, arsenic, etc. And so it is about getting the levels as low as reasonably achievable. And as Steve has said, you can't extrapolate from, or you can't count fatalities because you can't say that someone has had a cancer 30 years down the line because of a particular contamination issue. And as a consequence, I think there are very, very few acute issues with contaminants. When it comes to the communication, I think the paper explains the research we've done recently. And I think consumers are concerned about contaminants, but then a lot of the time they can't mention individual issues that they have, and there are many, many contaminants out there, and our general role is to manage them all as much as possible, working with the food industry. We do have specific advice on the arsenic in rice milk, and mercury for pregnant women and others. But consumers said from our recent studies that they don't really want to know too much because they want to be reassured that we are doing our job. But we are using the results from that study, working with our comms team, to see how we can maybe design the future website to mean we've got enough information to give that reassuring message, but also when we need to do targeted advice, we can see what we need to do.
Thank you. Colin.
Yeah, just a couple of points, many of which have already been made, but it strikes me that we're probably never really going to have sufficient resource to do all of these things. And the question was discussed at the Northern Ireland committee last week, was are we doing enough in collaboration across the UK? So in other words, are we doing enough with the scientific institutes and so forth that are operating within Northern Ireland and Wales? Are we doing enough with the universities? Are we doing enough with industry? And indeed on the consumer side. So if you go back to some work that NIFAC did a few years ago with Chris Elliott and Food Fortress Northern Ireland, and not just in Northern Ireland but across the island of Ireland, given the importance of the food industry to those economies, there's a huge amount of work being done by industry, and there's an awful lot we can learn. The reality is that we need to do more collaboration, both on the consumer engagement side and on the science piece, if you like, with industry, that we can learn a lot more. So I'd just be interested, what more can we do with other jurisdictions, with Wales, with Northern Ireland, indeed with Scotland and the Irish Republic, to actually add to our base of knowledge, both in terms of, say, industry and science, and indeed consumer engagement, because very often consumer engagement around this will come from other bodies, will come from the NHS, will come from other health authorities, and will come from industry. So what are we doing, and what more can we do?
I'll let Mark talk to the point about collaboration and our existing collaboration with industry, but I think also we shouldn't allow anyone to think that we're stepping away from the fact that we are in England, Wales and Northern Ireland the food regulator, and so we have a responsibility to ensure that these risks are identified, and working with industry that they are managed. No one else is going to take that role. That's one that we can't seek to devolve to others, although how we discharge it will clearly be based in collaborative work, because we don't make food ourselves. We need to work with the industry so that they take action. Mark.
I think just on the collaboration with industry, I think as the suite of interventions in the diagram on page 6 shows, with contaminants, we're not immediately going for the maximum levels. We want to actually work with industry and others to find other ways of minimising the risks. And I think, to be honest, we do have very good relationships with industry in the UK and at European level, but also across the world in developing codes of practice, guides, and etc. that can manage the risks and obviously share data, which is the most important part. So I think we've got some good networks there, and obviously we can work with the retailers in particular on sharing messages as well for consumers.
Before I freeze to death, sitting underneath the air conditioning unit as I am, which is why I'm shifting about, I do want us to focus, if there aren't any other comments around the board table, on paragraphs 3.2 to 3.4. These are really fundamental about the role of the board in relation to this. And there have been two, I think, areas that we've covered in the conversation, but I would like us to be certain of before we agree. First of all, these are principles about how the board is going to operate, but the board absolutely may choose to change those principles or to pull an issue up to the board table for the future, so I wouldn't want that to be overlooked. I would like us to be really certain on the board's role on communication about chemical contaminants, because as Steve explained very clearly, these are complicated things to communicate to an audience who very often just wish to know that somebody is dealing with it, that they don't need to be anxious about it, because the potential for raising a great deal of anxiety without giving consumers very many things they can do about it is possibly not the most helpful step that we can take. So the unintended consequences of those messages are really important. There is a slight sort of difference in the paper, because in paragraph 3.6 it says that we aren't currently planning any current or new consumer engagement activity. But at the end of paragraph 5.1, it talks about building on communication of chronic risks. So I think the board wants to be really clear about the board's role on communicating, on specific decisions to proactively communicate. I think Mark explained it very well in terms of where we make sure our website and our other general publications have got good information that help consumers understand, compared to where I think the board wished to be actively involved in making a non-urgent, non-crisis decision about an increase in communication activity and proactive communication about any particular issue to do with chemical contaminants. Because I think what we've seen when we've had anxieties about this in the past has been the risk of the board being confident that it's the right issue for us to be choosing to use our communication resources and our reputation on, as well as the limited opportunities we have for headlines, as well as knowing it's the right issue, that it's contextualised in the right way. And that, to me, where I'm reading where the board is, that is an issue for the board to want to have a line of sight on before it happens. That's not about crises or urgent matters, and it's not about the general level of information that's provided to the board, to the public, through the website, etc. Is that where the board is? Because I do want us to be absolutely clear in terms of getting these conclusions right about the way the board's going to operate. Yeah, Ruth, did you have a so?
I think it is. We do need to be clear about that. I think it's also about using that hierarchy of principles when a consumer-facing campaign is insufficient and will not enable the consumer to take effective action, that it has to be stepped up. I think the board would be interested to be clear the judgments that were being used on some of these longer-term risks, to know when actually it needed more intervention. So absolutely agreeing with that point.
And the other thing was on paragraph 3.2, I wanted to be really clear. The first bullet point says the FSA Board takes decisions on priorities and direction if and when new risks or issues related to a chemical contaminant arise and are likely to require substantial commitment of additional resource. I think those are different points. The board doesn't only take that decision because there is a resource consequence. To my mind, the board takes that decision because new risks or issues arise related to a chemical contaminant. The resource issue is a secondary one in that, as far as I'm concerned. So I wanted to be confident that first bullet point, the two clauses on sort of equally weighted, that they're separate points. Are we happy with that? Julie, I just realised you had your hand up earlier.
It was just to pick up on Rosie's point about communication, and I was going to say not for the sort of planned communication that you've talked about there, but more of the responsive communication. We are using whichever channels that we see fit, whether social media or traditional media, so just give reassurance that we are always on it. We will not just rely on the website.
Stuart.
I suppose at the back of my earlier comments is the what I feel is a recognition that in terms of consumer communications, most of the biological threats are things they can do something about, whereas the chemical contaminants is in the hands of others. And I suppose that's the bit I'm trying to get right in my head when you're asking the board to take responsibility here and getting that bit right in terms of communication is the bit that bothers me.
There are often things that consumers can do themselves to change their food storage or preparation practices that change the amount and type of chemical contaminants in a food. A small example was, you remember when we talked about acrylamide, we talked about people not storing potatoes in their fridge because that increases the levels of sugars that are precursors for acrylamide. So there's often that sort of advice we might choose to give to consumers, even where the levels of chemical contaminants are present in a food, and there's nothing that consumers can do themselves to change those levels. There are still choices they might make about the balance of their diet. And the example Paul gave about our advice to pregnant women relating to fish consumption because of the risks from dioxins and methyl mercury is another example of a type of advice we might give. And I suppose what I was keen to put on the table when drafting this paper, and I think it goes to the point that Heather was raising, that there is a section of the Act, which I set out in 3.3, that is both a safeguard and a bit of help in deciding this question of materiality, the points and the issues on which the board might choose to intervene. And it may not cover everything you want, but I think it's certainly a subset of things that are clear board discussions, which is where we think, where in our judgment, our organisational judgment, that risks are material and materially impact people's ability to make informed choices about the foods they eat, whether it's individual foods, how they're prepared, or the balance of their diet, then we have a duty to make sure that they're adequately informed. And that's quite a significant trigger that carries activity with it. And I would always see that as being a decision that the board might take. But the question then is, so what are the other types of issues on which the board might take a view? And Heather said there are the points about new risks where we need to consider what the appropriate intervention might be. There is separate to that, the separate clause about significant decisions relating to prioritisation or resource calls on resource. And I think this is very helpful for us because it's starting to build this picture of, in practical terms, rather than these principles on the page, for us in practical terms, the issues that you would expect us to bring back to you.
I've got Guy, Paul and Ram.
Thank you. Colm asked about the collaboration aspect, and one of the things I think which leads on from what is just being discussed is that it's very clear that many other government departments and beyond government departments face this issue in a whole range of aspects. And therefore, one of the things which has been useful, I think, in the last 12 months or so is we've met with many of those other government departments with a focus on how to communicate public health risk, actually, and made a lot of progress in terms of where we can have a shared approach, and at other times when there's obviously quite key differences depending on when where and how you're working. So I think it builds on what Jason was saying in terms of the work with Food Standards Scotland, in which we are learning from best practice. We're trying to actually put into the mix, where we think we're kind of more advanced or developed than, say, Health and Safety Executive. And it is something that the Science Council quite clearly said to us when we were having the discussion with them, is the issues we face are not unique to us, and it must be occurring right across the mix. And the recommendation, loud and clear, was how well are we connected with all these other people. So one of the things I can offer as an individual, and I know there's others in the organisation doing this, is absolutely ensuring, whether it be Public Health England or Health and Safety Executive or DEFRA, we're actually working very closely with the people there who face this issue to do with how you deal with these chronic lifetime type issues. And then if you do go into an aspect of trying to communicate information, how you do that in a measured way, which is informative without being scaremongering.
Sorry, just come back on that. I think great to hear that, but the three examples you gave were all English-based. I suppose the point I'm making is that there's tremendous resource in Northern Ireland and Wales and in other parts of the UK and these islands that we need to tap into as well. I think that's really just the point.
Paul?
Just coming back to this communication issue, I think part of what we have to recognise, which is sort of implicit in the discussions we've been having, is there's two sorts of consumers here. There are the consumers who are desperately seeking out information. So if you are pregnant, then there is quite a high probability that you will go to websites like the FSA's to find out about nutrition and the best practice that you can take. Whereas there are other issues where actually the consumer just hopes that somebody is looking after it. And I think when you get into difficulties on something like the acrylamide, where the consumer could be doing things to improve or to reduce their risk, but actually they're not that interested, and we have to try and push the message out to them and communicate. And I think that is when, I think from a board perspective, or speaking for myself, I think the stuff that is there as useful information that is clear that people may seek out, I think that's straightforward. I think where it becomes difficult is when you get to these issues where the consumer probably isn't that aware, potentially isn't that interested, and we are trying to find ways of getting out to them what they can do. And I think that's where you get into the balance between what is the useful resource that you can put into this and what actually is going to be the effect in the end. And I think that's when the board would like to have some understanding of what new risks are and how we're going to work on those.
Thank you. And Ram.
Chairman, I come back to point 3.2. And having said that, the iPad has gone haywire, but I'll tell you the point. It says the FSA Board has its responsibilities, and then in 3.4, thank you, it says, that's right, 3.2, and then 3.4 it says the executive team implements. I'm trying to imagine a situation which I know happens more than once or twice, it's happened a few times, where research is available to the executive, which requires immediate attention and action, which under this guideline says the board would make the decision. Now, I'm assuming there are mechanisms in place that would enable you as chair to take the appropriate action and, if necessary, to call a board meeting, because we cannot wait. We meet 4 or 5 times a year. And I've seen examples in the past year where a research piece has arisen and action has been taken. And as a board, how would then the practicality emerge from this to ensure that the principles we're agreeing are complied with from good governance point of view? Thank you.
Yeah, I actually think those are very few and far between, because research doesn't land in our laps unexpectedly. There's usually a line of sight into what might be emerging. So a crisis is a different matter, and we have well-established mechanisms for dealing with a crisis and an immediate response to that, and I think they are tested frequently enough. So I think mostly I'd expect there to be a line of sight, so the board to be prepared. And then you're right, if for some reason something very unexpected happens, it's not a crisis, but it's new news,
yes.
Then I think we would have to look at that on the individual basis and determine the extent to which the board needed to be convened particularly, or that there was sufficient confidence that the board's decision was delegated to me,
exactly.
or me working with the deputy
Absolutely.
chair when one's appointed.
Yeah, I just wanted clarity to finesse that, so
yeah.
It's what's sometimes not said gets into the blurred line and grey area, and I think it's important that it's absolutely clear. Thank you.
Chris.
Thanks, Chair. Yeah, just to follow up, I mean, obviously I've been listening with interest to all the points on resource, and I definitely think it's something that we can provide more information on at the right time. particularly as we go into the next budget year. The one thing that I would mention is it's probably worth taking a medium-term view on this as well. Obviously, we're about to move out into EU exit, and therefore our role in lots of different policy areas may change. We obviously don't know how it will change, but it may well do.
Well said. I think unless there's anything anybody else wants to mention, that's a brilliant lead into the conclusions of this, which I think we are endorsing the report with the adjustment we've made on the points about the responsibilities of the board and communications. We are going to come back to a discussion around this table when we've got the various inputs that have been referenced, the work that Guy's been talking about on risk assessment, the input from the Science Council on establishing risk uncertainty and communicating it, because I think all of those things come back into that ability for us to know on what basis we might be forming those judgments and how comparative they are, all of which also starts to give us a foundation for whatever role we might be playing once the UK has exited the EU. And I think thinking about any resource consequences of that definitely are for the medium term, but we should have most of those inputs before we get to the point of setting next year's business plan. So if there was something we wish to do immediately, that is within scope for us, but Chris has flagged quite rightly that we do have, we are not suggesting that this at the moment is wildly wrong, that there's nothing causing us to think this needs immediate redress, but also over the next couple of years we are under some resource pressure, so medium-term planning for any adjustment will be really important. Thank you very much, everybody. We will move on now to our paper on the well-being of future generations. Thank you, Mark, for attending. That was super. Nina is going to introduce this. First of all, any declarations of interest or...
Just a reminder, Chair, that I've been appointed to chair a parliamentary review of health and social care in Wales.
Thank you very much for reminding us of that. Nina, I'm delighted we have this paper on the table, so would you like to talk us through it?
Thank you. So this paper, quite, I hope, self-explanatory, but it describes the actions taken by Welsh Government through the introduction of the Wellbeing of Future Generations Act to improve social, economic, environmental and cultural well-being in Wales. And whilst not named specifically in the Act, the paper also shows how the FSA seeks to act in the right way to support the ethos of what's in the Act. We've started that journey. We've taken some of our current work and mapped it against the goals, and I think that's a journey we'll continue to be on. And we had really useful insight from the Welsh Food Advisory Committee, sort of guiding us to thinking also about how we can more visibly demonstrate the impact of the actions that we take. So what measures might we have that show traction against the drivers in the Act? So that's what we've tried to do. I think it's a really important thing for the board to consider and be aware of, and it's very important in Wales. This is driving the direction of Wales, and you know, potentially we could say Wales are leading the way on this sort of vision for how you look after the future.
I'm not going to let Colm argue with you on that. Ruth.
Thank you very much, Chair. First of all, the committee was really pleased that the FSA Board was looking at this policy. It is a substantial piece of context-setting policy in Wales. The opportunity it affords is twofold, really. One is it requires public bodies to think about the way it makes its decisions and conducts its business. So the 5 sustainable development principles of take decisions thinking about the long term, be preventative, collaborative, involve people and work in partnership. So I think those are, you know, important principles that certainly most of the public sector that's named in the Act are required to think about whether they're really driving that agenda. So it's helpful for the FSA to think about the ways of doing business, and I can think of lots of examples where the FSA actually could say, yeah, we actually do really already adopt those principles. The second level of the Act is there are these high-level goals, but perhaps what isn't so clear in the paper is that there are indicators that sit behind those goals, and government has published 46 national indicators. And the essence of the Act really is not to say, yes, we fit with what it's trying to do, but actually, how are we going to drive harder to deliver the goals that are set out, and what measures would we use? So I think it falls to the FSA to think about its business. So there are some high-level indicators about individual well-being, and of course, the way people are employed through the FSA are all part of creating better health and well-being for the population. So there's opportunities as an organised corporate body, which indicators might be relevant in terms of climate impact or environmental issues or human health, but also in the delivery of the business, are we demonstrating measurable improvements in some of those indicators. Not all of them are relevant to the business of the FSA, but I think the important thing for this legislation is it's not about do we comply with it now, but actually can we evidence we're making a difference for the future. And that was the essence of the discussion.
Cole.
And I assure you, Chair, I'm not going to argue with the statement that Nina has just made. In fact, we in Northern Ireland Health and Social Care work very closely with Wales and have engaged quite a lot with Dr Tracy Cooper, the Chief Executive of Public Health Wales. And a lot of this, I mean, I think it's a super piece of work, you know, and I think that all of the regions of the UK can learn from this Act to take things forward on a collaborative basis. So the more that we can actually learn from this and make sure that the FSA are plugged into this, but I think that certainly from a Northern Ireland perspective, and from an English perspective, we should be taking the learning from this and seeing that we can do the sort of things in the other regions of the UK, that they're ahead. They are a little bit ahead of the curve in Wales. We need to get up to speed in the other regions.
Thank you. I thought the way that the annexes were laid out was really particularly useful and accessible. You know, if your heart would sink at the sort of 5 principles and 7 points and 40-odd performance indicators, but you've brought this together in a way which is, you know, gives us a lot of confidence that we are absolutely, in the way we choose to operate, we are in the right space already and making a positive contribution. And I think being able to reinforce that for all our colleagues in Wales and for the Welsh Government is a really important step for us to be taking. Any other input on this before we move on? Steve?
Just a reflection, because just as this has caused members of the board to stop and think about how we do our business, I think it's caused many of us in the exec to have the same reflections as well, in a couple of areas. Firstly, the 5 principles and how we can integrate those into our approaches to open policy making. I think we can already demonstrate ways in which we do, but this appears to me about a call less to have a checklist mentality and to say we do this already, therefore the case is closed, and more about a spur to improvement, and as Ruth said a couple of times in her comments, to really think about what we do and how we do it. And that struck me too when I had a quick read through the list of indicators, 46 of them, which just brings home to you the range of factors that have the potential to impact on people's well-being, factors at the personal level, at the community level, and at the national policy level. So our response might be around thinking about those national impacts on national policy when we undertake impact assessment, and there's a new health impact assessment framework in Wales which will formalise that in terms of how we undertake the thinking and document it in respect of legislation that we implement in Wales, but also thinking much more locally about what we do in our own organisation and with our own people. Jason said at the outset in his Chief Executive's report that our people are our most important asset, and he sets out the work we're doing. And given the potential impact on well-being of people feeling valued and supported at work, you know, we have the ability to really think through the impacts of our new people offer, our approaches to physical spaces, think through how these are improving the sense of people feeling valued and cared for in our workplaces, and we have some ways of measuring that as well. So we should, I think I'm with Ruth, this is not just something that we should consider, say we're good enough and say it's done, but reflect on this as we think about how we develop and implement policy, but also how we do things a bit closer to home as well.
Thank you very much. Excellent. I think we are very happy to endorse the conclusions and the recommendations in the paper, and also strengthen that point about the indicators we ourselves are choosing to deliver against in the way that we run the department. So I think that's another component to ensure we reflect. We'll break now for 20 minutes and reconvene at 11:15. Thank you. Welcome back. After the break, our next discussion paper is on developing our approach to identifying risks and issues across the food system. Are there any declarations of interest on this paper? If not, Patrick Miller's joined us, who heads the Chief Scientific Advisors team for the FSA, and I think Steve is going to introduce the paper. It's a Steve Wern show today.
Thank you. Although this is a joint paper by myself and Guy, and I'm certainly happy, after a very few introductory comments, to turn over to Guy and Patrick to update on the specific discussions on this area in the Science Council last week, which we foresaw when we were drafting this paper. This paper is a bit unusual in terms of the issues we bring to the board. This is, if you like, a prospective issue. We're seeking your input at the initiation stage of what we believe should be a new stream of activity. And so how we've got to this position is understanding or seeking to understand what being recognised as an excellent, accountable modern regulator, which is our ambition, means, and what capabilities we need to support that. And we believe that part of that capability set is generating informed and integrated view of the global food system and of the systemic risks and issues that sit within it. The paper refers to and describes in summary our current and developing capabilities around surveillance and around horizon scanning, and our analysis that while those are necessary, they're not sufficient on their own to develop that broader capability that we believe we need. And so the suggestion was that we, at the first stage, engage the Science Council to help develop our understanding of how we might approach the issue, what capabilities we might need, what opportunities there were to develop them. And so that was one of the issues discussed with the Science Council last week. And Guy, I wonder whether you wanted to take over.
Okay, thank you, Steve. As Steve said, we at the first meeting of the Science Council last week, we discussed this particular issue, and I'll give you, obviously there'll be formal record of that meeting coming up, but I'll give you a few early comments. At that meeting, Sandy Thomas, Heather and myself worked very hard to develop an agenda where we set some quite specific questions, and they're outlined here. And what was very enlightening, I suppose, at the actual meeting we had is when discussing those questions, these questions are incredibly linked, and the horizon scanning question actually enables you to be more confident that your first two questions are being answered appropriately, and in time you keep answering them appropriately. So if I tell you what those questions are, I think it may be helpful. So the first one is we had a big discussion about the new council offering their input into how you, the board, can be confident that you have access to the right scientific capability and capacity, and that the assurance of the evidence and the information you're getting is as you wish. The second was the issue of how you can communicate this difficult area about uncertainty, which is and communicate aspects to managing risks and why decisions are made in certain ways, because as we know, and as Chris highlighted at the end of the previous discussion, as we potentially enter into a world in which we are in a position to do risk assessments and make decisions based on those risk assessments as an individual United Kingdom, as against contributing to votes made across 28 countries, the ability to then communicate how that has happened becomes even more important. And then the third question we asked them was to help us develop our ability to do horizon scanning and foresight work. We're particularly fortunate in which the chair of the new council, Professor Sandy Thomas, spent about 5 years in government heading their foresight team. So we have probably one of the world's experts in foresight. And in fact, during that period of time, she actually commissioned and ran the foresight report on the future of farming and food from some years ago. So it is incredibly lucky that we have managed to attract somebody of that calibre to head up the new council. And during the discussions from people from backgrounds in industry and academia and public health, the discussion to do with that foresight, they kept coming back to the fact that this will enable us to make sure that you do have the capacity and the confidence you're getting the right information. This will enable us to work out that if there are new risks emerging or new issues we ought to be concerned about, and the trade-offs that were discussed in terms of nutritional benefit versus exposure to mercury, etc., is that these things, knowing they're coming along, means you can prepare for them so you can adjust your capability or your ability to communicate them. So that, I think, was very exciting. We have some timelines on these things. So the first 2 questions, we wanted some initial feedback in 6 months. And then the horizon scanning is a slightly longer objective, which is part of the reason today to discuss how the approach should be. I think the one thing that is worth highlighting, and I think is important, is that many people do foresight, many people do horizon scanning, so why should we just do it? Why aren't we just picking up what's being done elsewhere? And the answer to that is we are going to pick up what's being done elsewhere. What we're going to try to do is synthesize the stuff that is being done elsewhere, but piece it together to make it relevant to us. And we identified there are 2 aspects of uniqueness. Uniqueness number 1 is that a lot of people working in this space do not look at the whole system. They look at the issue of how is the future of food production going to happen? How is the future of food nutrition going to happen? How are we going to do this and not destroy the planet? Very few people consider the system, and the reason the system is important to us is the area of interest to us is obviously food safety, and how those other things happen has a big implication on the safety question. So we can capitalise on all this other work and make it relevant to us. And then the second aspect of uniqueness is that around that table, and certainly some of the research I've been doing, is that the majority of people doing horizon scanning and foresight in this space do not do it with the view of what does this mean to UK consumers. It tends to be done in a very different way. So the 2 aspects of uniqueness is the food system, but with a safety lens, and UK consumers, and that's why we will focus in on putting our effort and resource specifically in that, but capitalising on all the other work that's going on.
Thank you very much. So just to reiterate, this is not where we're setting a position in stone. This is one of those board papers where we're starting to share our views to help the executive team develop our thinking for the medium term on this. I personally am delighted that we've got this paper in front of us, because for me, looking at risks through a global lens is the best way to start, and understanding what our role is and also where the risks are on the boundaries of our role, which also should concern us. So I'm really pleased to see it here. Rosie.
Thank you very much, and also to echo how pleased I was to see this paper in front of us. Just a comment really, which is when this gets further developed, it mentions in the paper that we're looking at the medium term here, and I suppose from a board member's point of view, what I'm interested in is what sort of milestones we'd be looking at to see that we're heading in the right direction and how we're going to measure progress. The Science Council is now formed. It doesn't meet terribly often, so it's really about how we can get some momentum going and how we would expect to hear back on the type of milestones and progress to achieving some of the things that are mentioned in this paper. And just to endorse that, I'm really pleased that we're going about it in the way that's been described by Guy and others.
Who wants to talk about how we see the process playing out? Because we've got to conclude the process and come back here to then take a view on what we think our position is. then to set some milestones for implementing that position, I think. So we're thinking we've given the Science Council at least 6 months for this, haven't we, Guy?
I'll comment specifically on them, and maybe Patrick and Steve in terms of the other parts of the organisation working on this. In terms of the Science Council, we recognise that they only meet in open and formal session twice a year, but it's recognised actually that there's lots of work to be done between those, and we will be having discussions in the next few weeks about the different modes of operation we could adopt to enable that to happen. It might be task and finish groups, it might be virtual meetings. There's a whole range of options open to us, and one of the things that I know Heather has spoken with the Sandy about and was discussed at the council is that the ability and in terms of the capacity of the individuals concerned and the resource of the agency to enable that to happen, and our view was and we had support from the members of the council about this, is that they are willing, and we would obviously be keen to actually meet not the whole council but as smaller groups on a regular basis between those 6 months. So that's why we have quite a reasonable amount of confidence that we will make progress between those meetings.
Probably also worth saying that Sandy Thomas will be attending our board meeting in March to feedback on progress as well. Ram and then Colm.
Yeah, thank you. Like Rosie, too, I'm really pleased to see this paper. I think it's an excellent piece of work, and I like the direction of travel highlighted in the paper. Just a general comment, really. Well, a question as well in that comment. In terms of the global scene, I realize we are looking at it through a food safety lens and UK consumer-centric. But I would imagine that, for example, in the US, the FDA might be engaging in a similar exercise, Australia, New Zealand. So in terms of the global aspect of this, is it possible to draw from whatever is being done in those parts? And maybe it is included in part of the cross-departmental, cross-government working. And then private sector. You know, Amazon's taken over this huge food company. It'd be interesting, you know, would the private sector be prepared to share any information with the FSA? So there's Amazon Foods, there's Cadbury, Nestle, who I know we have good relationships with. And then and Google, for example, amazing futures lab there. And then BT, I know, have a futures lab. You know, do they have any work in this sector? So it's just throwing those thoughts in to see if they are being trawled for information exchange and ideas.
I'll let Jason pick up that point about our industry relations.
Yeah, thank you, Ram. And it's an area that we have put a renewed emphasis on. We are working with industry. It's a topic in terms of, you know, data access, data sharing that comes up in all our discussions with industry. I think we need to build a climate and a confidence and a trust relationship with industry, and the specific examples that you've given are good examples. And I'm increasingly confident that they're increasingly confident that they can do business with us without feeling as if that they'll be exposing themselves to commercial risk.
Just a very specific point to build on that. So one of the members of the new council, Professor John O'Brien, actually started life as an academic and then became the chief executive of the Food Standards in Ireland, and for the last 10 years has been the head of the research labs of Nestle in Switzerland, and he therefore is actually bringing the kind of the Nestle expertise to us. But having worked in those other sectors, he can kind of contextualize it, which I think is important. And also, following on from visits we've had recently, a number of people from the FSA incident team and the surveillance team had a working trip to Nestle's research base in Lausanne, where they saw how Nestle are using various scanning software to to look at the internet of early warning signals of big issues that they should be aware of, so they can heighten up the surveillance in their supply chain. So we're on that journey of already beginning to work with organisations like that who, as you can imagine, are very, very good at this.
Thank you, Colin.
A lot of the points were not similar to ones raised by Ram, but a couple of additional points. Firstly, we really welcome the paper, and I think it's a continuation of a discussion we had at a recent board meeting about this very area and how we actually spend our fairly scarce resources. Given that they are scarce resources, it is important that we do keep that focus on the big global challenges, Guy. I think we get that, and make sure that we're maximised, again, across all of the devolved nations as well as England. One thing for me is how we manage the Science Council going forward, because in my experience, nothing frustrates really good scientists more than they don't feel that they're being listened to. So given that they don't meet terribly frequently, it's how do we ensure that we are taking on board the advice we're getting. It's a fantastic team, and Sandy Thomas goes without saying in terms of the reputation. How do we make sure that they know they're being listened to?
I think we've absolutely set off on the front foot with that. So I think the fact that Guy and myself attended the whole of their first meeting really gave them some confidence about the importance we've invested in them. We've invited all the Science Council to meet informally with the board in December, so that that's a chance both for those one-to-one relationships to develop, but also for them to understand collectively the weight that we put on their advice. Sandy then attending an annual meeting of the board is a really important component. She will also make an annual report to the board. But I think more than anything else, you know, if they were to look at today's board papers and the number of times the advice we are seeking from them is referenced in our board papers, that shows them the extent to which we do want to, we need and want that advice, and we then want to act on their advice. I think they understand that they're still in the risk assessment box and that advisory space for us, and the decisions that we then take have other components to them, and they absolutely appreciate that. But I think I speak for Guy as well. Our feeling at this stage is that they are confident about the significance that they hold for us and our willingness to invest in them getting to good answers for us.
And I completely get that, Chair. I think the challenge for us as a board is to make sure that they feel that way in 12 or 18 months' time.
Any other input on this paper before it goes away and great brains think further about it and the Science Council cogitate about it and then they magically produce us with an answer?
One thing I would add is we have had conversations with the FDA and others, and I know Steve goes to Washington on a regular basis to have those conversations. Interestingly, when we explore and discuss some of the things we would like to do, for instance, optimising our surveillance system, organisations like the FDA say, well, please tell us how you're doing that, because it's something we would like to do too. So we're often ahead of the curve, actually.
Absolutely, it's a two-way street in all of these things, and it's that, you know, just recently, for example, Chris Elliott has done some work with China on food safety, you know, so I think that's the sort of work, given those relationships, that we need to learn from.
Yeah, and just to add in, you know, it's a component of our increasing emphasis on having a more prominent international presence on this and a range of issues, whether it's food crime or, you know, the issue we're discussing now, and the work that we're doing with GFSI and Codex and others, and taking the lead on third-party assurance papers. So we are, you know, consciously stepping into that more international space and looking to collaborate with other like-minded countries as much as possible.
Good, thank you very much. Next item is the report from the Chair of the Audit and Risk Assurance Committee. Colm, an oral update on where you've got to.
Thank you, Chair. It's been a fairly busy period for ARAC since our last meeting in March. We have met twice since that meeting, and two one-to-one meetings. So we met specifically on the annual accounts on the 25th of May, and then the full IRAC meeting to sign off the accounts on the 13th of June. And members will be aware that we didn't have time to wait until today's board meeting to get formal sign-off by the board. So there was input from the board into the annual report on accounts, and authority delegated to the Audit and Risk Committee to sign off on those on the 13th of June to facilitate the National Audit Office processes and so forth. We also had two very useful one-to-one private meetings in private, i.e. with no officials, both with the National Audit Office on the 25th of May and with our own internal audit with the Deputy Head of Internal Audit for the FSA yesterday. And I say it's important that these meetings, it's good governance, but you actually do get a lot of value from those private meetings and a lot of learning for the Audit Committee. The main body of work for the Audit Committee was to sign off the report on accounts, which we did. The authority said was delegated by the board, but feedback was given in advance of the meeting on the 13th of June by all board members. The opportunity was there to feed in. A very positive report from the National Audit Office for those charged with governance, so no issues raised by them. And I think that's important from the point of view, both in terms of true and fair account and in regularity. The reports highlight some very positive performance from the agency over the last 12 months and continued financial prudence from the authority. We have been through a period across the UK public sector of austerity for some 6 or 7 years now, and I think the agency has been exemplary in how that has been managed, and that's reflective in the accounts. So congratulations go to the Chief Exec, EMT, and all of the staff across the agency for bringing us to where we are on those accounts. A very complex set of accounts because it's actually 4 annual reports and accounts. It's not just one. We have the Westminster accounts and then the 2 devolved nations in terms of Northern Ireland and Wales, and the full set of consolidated accounts. So quite a bit of work involved. And the easy bit for the Audit and Risk Committee is we're just reviewing them. All of the hard work's already done by the executive team before it gets to us. So again, thank you for that. At our meeting last week, we looked at a couple of key issues. We had an update on risk management with particular changes in risk in relation to preparing for the UK exiting the EU and our major regulating our future programme. We also had a very useful update on the Evolve IT programme, and we're all satisfied that the risks have been very carefully monitored and managed. The Julie Pearce and Philippa Taselli give us the update on the very critical IT, the Evolve IT system, which is making tremendous progress. This is one of the most major changes we're likely to make in terms of delivering that capability, and very significant enhancements for the business and support programmes. Very strong director-led programme, and I think with good governance and risk management built in around it, so there is a good risk matrix there, and we're satisfied that will deliver on time and on budget, which is quite unusual to say about an IT programme in my experience.
Julie's crossed all her fingers at that point.
We had an update on the local authority enforcement monitoring system, which has been on the risk register and on the audit committee since before I came on board. We are making some very good progress, and IRAC we're assured of the robust escalation processes in place. I'm very keen over the next 6 months to make sure we sort of move that off. It's been on the agenda now for the better part, probably over a year, and I think we really do need to make sure that we keep it moving and close it off once and for all, and understand the risks involved in all of that. We considered the forward agenda for the Audit and Risk Committee, and with a particular focus on developing a longer-term strategic focus. One of the things that I've observed since coming into the agency is we operate on a 1-year internal audit cycle. That's not what I'm used to. I don't think it's the best mechanism to use, so I think we're starting to move much more towards a 3-year approach to the internal audit programme, with a continuing focus on creating the resource for continuing improvement without taking the eye off the ball on the assurance that it gives back to the audit committee. And that's pretty much what we've been working on over recent times, and whether Ram or Ruth would have anything else to say on that.
Thank you very much. Any questions from board members about that? I had a question. Have you started to think yet? I know you're looking at the risk management for regulating our future for the transformation programme. What point do you think you'll start to think about how the IRAC committee will get assurance over that future implemented programme, because I think it's really important that as we design this future way of operating, we do that in harness with thinking how we will get our own assurance about our contribution to that.
I think from the point of view of our chair, we would see that developing into basically business as usual. You know, I think there's a good risk matrix there to take us through the project. That project will cease to be a project, and therefore there'll be a risk management for that. It's already on the corporate risk register. That will develop into other items on the corporate risk register with a strong risk management framework behind that. So I think the fact that we have a very strong risk management framework within the agency, that will lead its way into that quite simply.
Is the committee confident that our audit colleagues are connected enough into that programme so that their voice is being heard as that programme continues to be designed?
Yeah, I think the voice is being heard, and I think that they have become actively involved in regulating our future and in the Evolve IT programme. So I think that support is there from the project leaders, but I'd be interested in the Chief Executive.
Yeah, well, if we take an example, just to connect two things up with the, with the Leans report, I know that, Nina's commissioned work, because we know that that won't be sufficient to give us assurance in a regulating our future world. That's not going to give us the oversight of local authority and broader performance that we need. So it's commissioning work around whether there's an opportunity to introduce a more balanced scorecard approach. And obviously, as we get further down the line in terms of different elements of regulating our future, we'll be looking at specifics within that. So when we introduce enhanced registration, then we'll be doing the review of how not only how the implementation has gone, but how live running going, and then at a point of satisfaction, then it becomes business as usual. We move on to the next component. So I think there's anticipatory work going on, saying actually how would we get assurance in a future regulation system. And Leans isn't the answer to that for local authorities, and also then looking at each component of the programme as it transforms from design into implementation into live running.
And I think also the move into the longer term planning horizon will lend itself exactly to that.
Yeah, excellent. David.
So if I can just pick up on a couple of relatively small points, but obviously a lot of work we do within AWAC is around preventative stuff, but a couple of incidents have happened that would just be interesting to see how well our systems cope with. One, we had our unplanned outage at Aviation House, which the day-to-day activity seems to go on okay, but it'd be good to get a view from AWAC on whether they believe we could handle a crisis when such unplanned activity may happen. And the second point, the ransomware attack, which many businesses, both private sector and public sector, experienced last month, how our defences coped with that, and understanding that they were suitable, and we know what we caught and what we didn't catch.
No, I'm going to pass over to the executive to give the answer. Both of those issues were raised. I raised the issue on the day that the NHS attacks took place on the ransomware, and was given satisfaction and assurance that week by the executive. So I let Jason and others talk to that. And similarly, the Aviation House outage, and again raised that at Audit and Risk Committee back in last week, and again given assurances. So Jason, if you'd like to delegate. I
think it might get Julie to answer on the IT and then Chris to answer on Aviation House.
Yes, on the WannaCry attack, we were not affected primarily because we were up to date with our patching. So that was the main defence, that our software is up to date as far as possible, and we put a lot of effort in the last year to ensure that it is up to date.
Yeah, in terms of the Aviation House incident, which happened over Easter weekend, we've obviously been liaising with the landlord over how that went. Broadly, as you say, it went well, and the organisation continued to operate. Obviously, lessons being learned, as ever. So our business continuity lead is looking at that and currently refreshing the plans, actually. When we discussed it at ARAC, we agreed to present a paper back to ARAC to summarise any lessons learned and how the issue's been dealt with. And certainly, as we move out towards the end of the Aviation House lease, just to make sure that everything is happening as it should do.
Yeah, just to add to Chris's points there is, and you know, examples like that is when the work that we're doing elsewhere with our people in terms of new contracts, flexible ways of working, the evolve IT flexibilities, that's when it all becomes you know, more useful than you'd anticipated. So yeah, you know, it's designed to help day-to-day work be more efficient, more effective, reduce some of the footprint and carbon issues that would link back to the Wales paper that we discussed earlier. But when you're in a situation where one of your main buildings goes down, having that technological capability and having that as an established way of working and being able to work remotely, not just from home but from other locations and other government hubs, that's when it becomes really, you know, really critical.
Just coming back in though to seek clarity that whilst we handle that disruption, if Sod's Law kicks in and we have a major crisis to deal with at the time of that disruption, are we comfortable that we can do that?
Yeah, I think if I can go back on that, the two issues you raised, David, the first item and the assurance we received from that was shared with Board through the weekly briefing update. So there is an assurance paper from that. The assurance paper we've asked for at the IR committee last week. Whenever that comes out, I'll ensure that's shared with Board as well to actually show the steps that are taken. So the answer to your question is yes, there is a level of satisfaction that we will be able to deal with a crisis.
Yeah, absolutely. And I think the answer to that, as Jason's just alluded to, with the flexible working tools, etc., is that we feel that we would be able to cope, but it'll come back in the paper. Obviously, we had the issue at Foss House, where actually at the time there was probably more reliance on some of the IT kit that was on site at the time, and we managed to deal with that in a way which didn't harm consumers, and business as usual was kept going, and that was over quite a prolonged period, over a month. So we have been tested recently and managed to keep things moving.
Thank you very much. And just to echo Colm's point, to thank Chris and the whole team on the complexity of pulling that annual report and accounts together. It's very nice to have that done. Thank you. We've now got the section of our meeting where we take any additional input that we've had from the Welsh Food Advisory Committee and the Northern Ireland Food Advisory Committee. Ruth, do you want to kick us off?
Thank you, Chair. Most of the points in terms of responding to papers have been picked up in the discussion this morning. The one area where I thought it might be helpful to highlight was the presentation we had on the food and use survey. As a committee, we've been looking to trying to better understand the particular consumer views and needs in Wales. And so it's really helpful to have a more detailed discussion about the findings of that survey. And the area that came up, and it actually coincided with the feedback on the attitude tracker as well. In that, Wales was scoring quite highly on concerns about affordability of food, and likewise in the food and use survey, concerns about food security. Now, whilst some elements of that are not the business of the FSA, the area we were interested in, I think the team were going to look at secondary analysis, was what the impact might be on food behaviour in relation to food safety when people are concerned about affordability of food and food security. So that was felt to be quite an important issue as it was coming through, the signals, if you like, were coming through two different separate types of sources, and therefore something we should be mindful of. I think the other issues in the letter have been picked up in terms of the group that's been set up through Welsh Government in relation to ROF, and we've made reference to the public health legislation that's recently been passed in Wales, giving more powers to local authorities in relation to food. I don't intend to pick up anything else, but happy to answer any questions. Thank you.
Anything that anyone wants to pick up with Ruth from that report, Paul?
One of the points you make is that the committee would value more detailed alignment of FSA Wales business plan. Perhaps I'm not understanding, but the paper we had earlier had some alignment, the welfare paper. And wasn't entirely clear what exactly the committee were hoping to get here, or what they were really looking for.
Thank you for the opportunity to elaborate. It refers to the point I raised earlier, which was we really welcome the fact there was a sort of almost a sort of, do we comply with the spirit and requirements of legislation on one level, but the real benefit of the Future Generations legislation is to continue to drive improvement. So what the committee was looking for was what elements would the business plan in Wales seek to identify as things that they wanted to improve on? So in the spirit of that, were there things in terms of the way the office worked, or staff-related issues, or something in the conduct of the business that suggested actually that one area might be something we want to try and do a bit better over the next 12 months. So we're looking for that thread through into, so what impact is it actually making on the way we prioritise and think about how we conduct our business in relation to that legislation?
Oh, Steve.
Thank you. Just to refer back to a point that Ruth made in her presentation regarding Food and You, this is a flagship social science survey and gives us valuable information on consumers' behaviours and attitudes. It's a significant investment for us, and so we're always keen to maximise the value we extract. We used it in a significant way in creating our strategy from 2015, but it's good to hear of examples where it is being used, and secondary analysis has the potential to add particular value to decision making across the agency. So I would encourage you all to look at Food and You and think about the additional analysis that might give us even greater value from that investment.
And just to come back on that point and link it to the Future Generations thing, one of the goals under Future Generations is equity. And so the reason we felt it was important to probe this particular area was in weighing up consumer messaging, that we weren't perhaps just thinking of population groups like older people or pregnant women, young people, but actually people's living circumstances might be an important area to understand, because of the choices that were being made, and therefore the messaging that was being adopted needed to understand those circumstances, and therefore make sure it's targeted effectively. So that's why we're particularly interested in understanding the consumer challenges that are being faced at the moment.
Thank you very much. Colm, views from Northern Ireland that we've not covered?
Yeah, again, mostly covered through the earlier discussion, and like Ruth, we had a good discussion on the Food and You survey. We found it very interesting. Some surprises in there, not that we're questioning it, but just a little bit of surprise around the table. We felt that we could maybe marry it together with the Kantar data and do some further analysis, and actually use it as a tool to work with other departments in Northern Ireland. We have an outcomes-based programme for government, just no actual government but hopefully we'll by the end of the month we'll be very close to having that again. And I think that in the role that the FSA can play with the Department of Health, the Department of Agriculture, etc., in delivering a number of the outcomes, some of this data will be absolutely critical to all of that. We talked a little bit also about the succession planning to NIFAC. We're one member down. We're not sure if the Parmsec is going to be able to sign off. I think he may be, but hopefully we'll have a minister to do that, so we'll be able to strengthen the committee again. And we will potentially have a few people leaving committee in the summer. At least one will definitely be leaving, and another may be leaving. So at least we have a succession plan to take that forward. And we have some plan for our next off-site visit to the eel fishery up in Loch Ness, which is we're very interested and looking forward to that. If I can just pass my congratulations also to Professor Elliott on his honour, and also to Dr. Elizabeth Mitchell, one of the members of NIFAC, who was also honoured in the birthday honours list.
I missed her when I was looking through. Thank you for that. Any questions for Colm for NIFAC? No. We had no other business, so that's the close of the open board meeting. I don't believe we have any questions in the audience or that have arrived online for us to answer. I think Lisa might just share with us what our audience has been.
Thank you, Heather. We've been joined today by 70 viewers in our live webcast, and All of the board meetings are broadcast live online, and this particular session will be available on the Food Standards Agency website from mid-afternoon on Friday, the 23rd of June. As has been said, there are no online questions. I just wanted to put it to the audience to see if there's anything from here. Okay. And for anyone watching online, we're always looking for feedback on these sessions, so any feedback can be given via email online and would be greatly appreciated. And finally, just some information on the next board meeting. It will take place on the 20th of September, and it will be in Belfast. And people can either join us online by registering on the website or come along in person, and we look forward to seeing you there. Thank you.
Thank you very much. I'm proposing that we now move into the Business Committee, if the board are happy with that. Good. So this is the start of the Business Committee meeting. I've got apologies from Martin Evans, who's our Acting Chief Operating Officer, who was unable to be with us for this meeting today. We're first of all going to look at the minutes of the last meeting. In fact, actually, I think just before I say apologies for Martin, I think Carmel Linsky is going to join the table. She might be on her way in if she's not here yet. She will be joining us, standing in for Martin. Draft minutes of the last Business Committee were circulated informally to the board. Are you happy that the minutes now in front of us are an accurate record of our last meeting? Thank you very much. The actions arising from that meeting, is there anything that a board member would like to pick up in terms of those actions arising? Very good. In which case, we'll move on to the performance and resources update. Richard McLean is dashing through the door.
Dashing.
Well, that is a dash. Oh, he's strolling through the door. Richard, welcome. Sorry if you weren't expecting us to be quite ready for you now. Quick game's a good game. Richard, our Head of Planning, Performance and Change, would you like to introduce the performance and resources update?
Thank you very much, Chair. So this is the update on Q4 from 16-17. One of the key outcomes for the agency is to ensure that food is safe, and one of the impacts that we're aiming for there is that fewer people are getting ill from food. We have good news to report in that area. I pull out at the cover paper there the number of people getting ill from Campylobacter dropping. That's obviously the ultimate impact that we're hoping for, but it takes quite a while for that to sort of feed through. That's one of the lag indicators that we report to the board. But there is also continuing good news in the sort of lead indicators in that space as well. So I report the press release that came out right at the end of Q4, and making a link to an earlier paper, Jason's Chief Executive report also highlighted to the board the figures from just last week's retail survey, which have come out, which continue to highlight the trend for a decrease in the levels reported of the highest levels of contamination for chicken. And so that, to me, is an indication that the good performance that we've seen in 16-17, if those lead indicators follow through as they have done previously, that bodes well, at least, for continuing performance into 17-18 as well. One of the key indicators for food being safe is that FBOs, who are responsible for the food, the safety of the food that they produce and sell, are improving their food safety. The key indicators here for the board are FHRS and compliance with the regulations also for the meat food business operators. What we're reporting here to the board are that both those indicators, where we already have a high level of compliance, they are continuing at that high level, and the trend is they are continuing to move upwards as well. So again, that's positive news in terms of the ultimate impacts that we're hoping to have for consumers. What the report also does is it highlights some of the activities. There was a question earlier about milestone reporting in relation to science. We've got in this report the milestone reporting from the corporate business plan. This is a little bit of a rear-view mirror for the board. It's reporting on what happened last year. What we'll see in the next report is the forward look for the new priorities that the board has agreed going forward. And we're moving to a more continuous planning basis where we'll always be able to give the board a 12-month forward look for that as well. So it's not just a rear-view mirror that we'll be bringing to the board next time. Nonetheless, what I think this does show for you is the high level of activity within the organisation, the way in which we reprioritised work, in particular to take account of the high level of work that Rod's been leading under the EU exit programme, the revised governance that we've now got in place for that programme, with EMT as being the programme board and with Heather on that board as well, overseeing that progress. You've also got notable milestones we're reporting to the board of the change activity happening within the organisation, whether that's changing accommodation, changing the contracts for all of our staff. These are significant things that we're doing at an administrative level that underpin and hopefully put us in a good place going forward. And you had the conversation just a few minutes ago on business continuity. It would be somewhat remiss of me not to draw attention to the fact that we've managed to do that while staying within budget as well. Obviously, more data there, more detailed slides, and the lead directors responsible are around the table. Happy to take any questions on that.
Richard, thank you very much. Rosie.
Thank you very much, and it's great to hear you're doing the forward piece of work, because I think that's what would be really helpful with this for the future. Just 2 points actually. One was around on page 11. It has some data about the stun, non-stun, and where the breaches are around that. And I just wondered whether that's an area we're particularly going to be looking at, because it seems, I'm not an expert on this, but it seems that the premises where they combine stun and non-stun have the highest risk, and I just wondered where we're picking that up and addressing anything around that. The other point, which Julie and I have had a chat about already, to be honest, but is really around how we're measuring the open data target, and we've set ourselves up to kind of try and achieve something that is virtually unachievable to get 5 stars on. And so my question was whether the Tim Berners-Lee star system was one that was going to sort of really accurately reflect the huge amount of work that's going on in this area and the steps we're making. Because if we're only aiming for a 3-star, what message does that send to the outside, when in fact a 3-star is pretty good in what it does? So it was really more about context of that target, and whether we should look at other ways to measure that.
Thank you, Rosie. I'm not going to make Carmel answer the first question around the table. so Jason might come back on the non-stun question, and then to Julie.
Yeah, thanks. So on the non-stun, it's an area that we know we've been paying particular attention to for some time. That's why we disaggregate it out in these numbers in a way that we didn't used to do historically. Those premises that switch means of the types of operation, clearly increases the risk. People are changing from one method to another method, and that increases the risk, and that's why we pay more attention to that, particularly at the crucial point, which is the point of killing, which is the area that there's most change in between stun and non-stun. So there is increased focus in terms of inspection and in terms of enforcement, and we're seeing some of that coming through over recent months. But also under the new enhancements to the Kronos system, which is our new MI capture system in essence, we're disaggregating again more precisely between the volumes of stun and non-stun by species, and that will give us better data on which to target any further additional action that we want to do over and above what we've been doing already. But it's an area that's that we've put a huge amount of focus on over this last 12 months, and we're seeing improvements in compliance, but it's still a high-risk area for us. And as I say, you're right to pick out we're doing stun in the morning, non-stun in the afternoon. The operators have more trouble switching between methods.
And Julie?
Yes. Overall, on publishing data, we are continuing to publish more data sets, so progress continues to be made at the overall target. As to the STARS rating, yes, we're aiming for an average of 3, but I think the STARS rating it is important because it's in part how usable the data might be for others. So to just publish data that is actually really hard for anyone to really use, there's sort of what's the point? So we like to push back to make sure that we're publishing it such that it would then be usable. But having said that, I think, what does that mean? I think that depends on each data set, and also we will be listening and wanting to hear from people to how they used our data, what might make it more usable for people. So I think that's something where we're both pushing internally to say to our people, just simply publishing it in some sort of flat file that's not machine readable, it's partial use. But then asking the wider world, people who might use this data, what would you like to see from us? How can we make it better where we think there's real value? And equally well, maybe turning it down in other areas where there isn't a great deal of appetite.
I suppose just from the outside world point of view, we're putting a lot of effort into saying that anyone who has an FHRS of 3 or less is in a bad place, whereas we're aiming for a 3 here, and it's just about making sure that we aren't sending out confusing messages to the outside world around what a 3 could mean.
So maybe if we include a bit more of the definition, because 3 isn't 3
jolly
isn't
good
bad.
would be a good thing.
Yes, I think it's jolly good, and it's certainly better than 1. So going in the right direction.
Thank you, Paul.
Yeah. So this is maybe just a curiosity, but on slide 4. The bacterial pathogens, the Campi, the E. coli, Salmonella, are all tracking down. Listeria's way lower in terms of the figures, but it's very noticeable that it's been tracking up since 2013. Is that an anomaly just because we're dealing with very low figures, or do we think there's actually something happening there?
I don't think we have a long enough time series to say with any certainty. What we do know, and what everyone acknowledges, is that Listeria most readily affects people who are older, and so demographic changes would lead to an expectation that there may be an upward drift in figures over time. We've not identified any new risk factors.
Dave?
After battling with science this morning, I'm into my comfort zone of numbers and statistics, so I've got 4 points. The first point, we note the increase in admissions through hospital admissions through allergen control, and also it's driving, I'm sure, having a significant impact on our number of recalls increasing. So I'd be interested to understand the work we're doing with industry on those particular issues. I know, for instance, in the gluten-free sector, there is a trade group that's been set up under the auspices of the FDF, which I believe has had at least some initial discussions. So it'd be interesting to see how we can work very closely with the industry that's also equally concerned about those issues. On slide 10, we appear to have greater issues of non-compliance on product verification in sheep and goats compared to cattle or pigs, and it'd be interesting to understand if there's anything of any import there. I probably bring this up every meeting, actually. We're still, if we look at slide 10, we're still suffering year on year with poultry animal welfare non-compliance doubling, whereas red meat is halving. We've kind of indicated that might be due to increased identification and non-compliance, but I kind of think for the third quarter running, that reason needs to be dug a little bit further into. And the fourth point, which is a very minor one, as we review the effectiveness of our measures and how we share them with the board, I think our sort of graphs on slide 17 about diversity are bloody hard to follow. I think actually we're doing some quite good work there, and it does appear that we've got certainly a much better ethnic mix at senior levels, but it's really quite hard to work out from the way we're demonstrating it at the moment. So, but if you can come back on the first 3 points in particular, that would be very useful.
Yes, and it's probably just worth putting on the record that the board did have a workshop yesterday to think about how we wanted to capture and measure our impact for the future. So that's that final point can be wrapped up there. So we've got 2 questions which are around the meat sector and one on allergens. Steve, do you want to come back on the allergen one first, and then between Jason and Carmel we'll do the meat ones?
More than happy to. So in paragraph 4 of the cover paper, there's more description and background to allergy. Figures are increasing. We believe a combination of increasing prevalence, awareness and ascertainment. What are we doing about it? I think some of our key interventions are around communication, both through traditional channels and social media, to maintain awareness amongst allergic consumers and among businesses of what should be done. We're seeing continuing instances of significant and serious illness, including, unfortunately, in some cases, death related to incorrect labelling of allergens in the food service sector. It's now a couple of years since the rules were changed and new requirements brought in. So people should be complying with those allergen labelling requirements. There's little excuse nearly 2 years on for not doing it properly, not understanding the allergy risks in your business, just as we would expect you to understand the microbiological risks in your business. So it's particularly a cause of concern for us that allergy alerts continue to increase, and this is a point that the previous chief executive mentioned and expanded on when the board most recently discussed allergy in detail. We've also, as the board decided at that time, undertaking new investment to understand better the issue of adult allergy and intolerance, which is driving a lot of the hospital admission figures, so we can better characterise what's going on and understand what some of the impactful interventions are that we might develop.
I think Jason and Guy might want to come on the same point.
Yeah, and I'm in my mind looking to utilise the work that we're doing around recalls as a springboard for doing a lot more on allergens. As Steve rightly said, we've had some particularly troubling cases. We had four deaths of teenagers in the first 4 months this year that have linked to allergy reactions, extreme allergy reactions. So I think the work that we're doing on recalls will enable us to, as I said earlier, to look at where do we make most difference. Undoubtedly, it will involve working with industry. But as the board will appreciate, it's a weekly occurrence of recalled products for undeclared, generally milk, nuts and other ingredients, and that comes week in, week out, and it is not restricted to small producers. So there are national and international companies that week in, week out are recalling products because they can't get the labelling right, and they don't know what's going into the product, or they're not declaring what's in the product, and that can't be allowed to continue.
Just before I begin going, I do think, it's the risk of bringing personal experience to a board table, it's also an issue in terms of food service. The lack of understanding in food service when you do need to know what's in your food, and the assurance you can be given when it clearly isn't assurance, you're being given the wrong advice, is also incredibly undermining. So I think we should keep an eye on the progress that food service outlets are making in their knowledge and their staff's knowledge of what's in the food. Guy?
And I just want to highlight that you're going to have a presentation from Sian in a minute, but she will give you a really good example, which is why I'm raising it, because it's to do with allergies, of why opening up the data that we have is being used by an organisation, Anaphylaxis UK, to raise with people who are really interested in this type of thing, and therefore it's kind of showing why publishing data, linking up with other people who then can use it accordingly is a very useful thing. And one would imagine with that sort of demonstration, the fact that industry can link into that, which then links into something else, is a really positive thing. So Sian will give you the details, but I think it's worth waiting for that presentation to see a really good example of why we're doing the opening of data.
Do you want to raise anything else, Dave?
Well, I suppose it just feels at this stage that maybe we're not leveraging the work of industry enough. I mean, as I think as Steve actually did refer to, it's their responsibility to make sure food is safe and what it says it is. There is a huge amount of effort going in from the standard food industry, if you like, but also from the allergen-driven food industry, whether that's free-form or dairy-free. And there are big businesses now involved in that, and I do feel we can work more closely. Perhaps we need a bit more data first, perhaps we need a bit more research first with those interest groups to make a faster difference, and probably to encourage them to make a faster difference. And maybe we have been a little bit too lenient with people who have continually had what they would see as a minor labelling issue without understanding what the potential consequences of that could be.
Can we wrap up, coming back on this point that Dave's raised, into the efficacy of recalls paper that's coming in September, because it gives us a chance both to cover in more detail what's happening and also to ask ourselves the question that Dave asked, which is, are we doing enough, and are there other channels and routes and fora we could be getting more impact from and in? That would be good. Maria, is on this point?
Yes, Heather, sorry, just to add, finally, we recently found out about some work that the Food Safety Authority had carried out in this area. They went out and audited some of their food businesses, particularly in catering, and I have tasked my team with having a look at that audit process just to see if there's anything we can learn from that and whether or not it can be replicated, because I think that's a pretty valuable piece of work.
That's really good, really useful. Ram?
Just to say, it was good to see the diversity data following my request at the last meeting, and also good to see the sustainability data. I suppose I look at that information and then I ask myself, so now what does it mean for us? How are we doing compared to the rest of the civil service, for example? What's our benchmark to say we are doing well or not so well? What can we learn from others? And maybe we are doing better, in which case reassuring. So one is on the diversity data and the other one was on the sustainability data. Terrific to see a 20% reduction. Well done. But are others doing it differently, and is anyone achieving a better result? So it's just trying to make sure that when we get this information, at least for me, I can understand the context and what you do with that information.
So I think we can come back with an answer on those 2 points in the board weekly circulation. But it is a good example that when we set our new impact measures and targets, we need targets, therefore we know what we're aiming at, and we can do that. But also of the temptation constantly to ask for more and more information to be put into this report, which makes it more and more impenetrable if we're not careful. So that kind of is a good example of the balance we're trying to reach. Any other points around the table?
So I haven't had a response on my sheep, goats and chicken.
Oh, yes, you had. Yeah, you're sorry. Your sheep, goats, and chicken. Sorry. Terrible chairmanship.
If I can come in on the chickens, I might hand the sheep and goats to Jason. So there's two aspects to the poultry work. Yes, it's higher. Yes, it's certainly on our agenda in terms of we're aware of the figures. As I say, there's two sides to it really. So work ongoing with industry to look at why there are non-compliances in the first place, work around the types of crates that are used, predominantly broken, poor, shoddy crates lead to broken wings, higher non-compliance there through poultry industry. And secondly, internal work really for us to increase assurance and awareness of welfare non-compliances with industry, and to go out and do some more work with them to start to try and target where we know there's higher levels of non-compliance and do what we can to educate and raise awareness before we take that enforcement action.
That does sound quite interesting in the sense of whether the non-compliances are in the sort of the, as it were, the DEFRA end of this or the food hygiene end of this. And I think it would be useful for us to understand that further when when we come back to it. Do you want to do sheep and goats, the biblical bit, and then Dave wants to come back?
Remind me of the question again. It's that long ago now, Dave. Remind me of the question.
It was in relation to page 10, where the product verification is significantly worse within sheep and goats than it is within pigs and cattle. The number of ambers is sort of, I don't know, probably 3 or 4 times the percentage that it is in pigs and cattle.
Yeah, I don't know. I'll have to take it away, Dave. I don't know what the answer is.
Rosie?
One more question from me. When I went through this, and it's a really informative report, and I think it's really excellent, it did strike me that how much of this could be in the public domain, and I just wondered if that is something that is under discussion or could be looked at. Obviously,
it's all in the public domain.
That's fine.
Yeah.
Good. Okay.
If that's it on that paper.
So I just want to come back on poultry again. I'm going to labour the point, and I'm not going to apologise. This has been going on for a year now. This trend of it being twice as bad as the previous year, and we don't really appear to be getting to grips with it. We're still talking about research. We're still talking about understanding. We're not talking about action, and that bothers me. What also bothers me, though, is that the numbers are going to start. The comparison numbers are going to start drifting away, and we might lose sight of the year-on-year performance. So I am going to.
So why don't we ask at the next business committee meeting to have a full paper on this issue?
Thank you.
Rod?
Very quickly, Heather, I just thought it links a bit to Rosie's last comment. Richard touched on this in his introduction, but I'm always conscious with the amount of information in this paper that there's a big chunk of our activity missing at the moment, which is the EU exit preparation work, which we can't put into this pack in the same way as we would everything else because of government restrictions generally on that area of work. But I thought probably should record in this open meeting that we do hope to get to a place as soon as practicable where we can be more open about the ongoing work, because it involves a huge number of people across the organisation, and it means that the picture presented in the detailed slides here is a bit misleading. So I think that's probably something just to acknowledge.
I think we can absolutely recognise and note that. Thank you. Well, despite the agenda moving a bit faster, people have flooded in from all over the country to make it in time for their papers on the business committee. So thank you very much. And all my frantic checking with people around the table about whether their teams are here was unnecessary because all your teams are here. So we're going to move on now to the business committee update on regulating our future, and Lee Sharpington, who's the programme manager director for that, is going to join us. Now you will recall, board members, that regulating our future is a regular standing item when the board meets. When we are taking a decision about that regulatory direction, then that's at the board, full board. We're in the business committee because this is a very long update on progress, input. There is no formal decision to be made in terms of the discussion here, but obviously board members are being asked to comment as well as to take assurance on direction. Nina, over to you.
Okay, so just a very brief introduction to say, obviously three months or more since we last updated you. We've covered quite a lot of ground, so the report, we know the report is long, but we wanted to make sure we were keeping you fully up to speed on our thinking and developments. Particularly excited personally about the new picture of the model, which I hope you've all now saved as your wallpaper. It's good to move on because although the 4-quadrant worked, we're really keen to show how we're refining the model, and it supports the open policy making style that we're still battling with people to understand. We haven't locked things down. We're sharing our thinking with you. We've got a significant piece of engagement coming up now with the local authorities. So I'll stop there and really just take questions, I think, because I'm sure there will be some.
Who would like to go first? They're overwhelmed by content, I think. Ruth.
Thank you very much. It's great to see the update. So just one area just to kick off the conversation. when we first discussed the registration process, there was a lot of interest, I think, in the permission to trade sort of position that was being explored. And I know stakeholders are quite keen with that and feel there is evidence that we ought to be pushing for that. I also understand that if you want to change legislation, you need robust evidence that there's a need for that legislation. So really understand the position we're in, which is about we need to build that evidence base. I suppose what I was looking for was what's the thinking in terms of when the judgment might be made to say we now have the type of evidence we need to make that decision whether or not permit to trade is something we're now going to actively pursue. Have you got a sense of that? Because I see that we're a bit behind on the portal that we wanted to develop to make it easier for people to register. We know registration is, people are not always in contact with the statutory bodies, so we know there's an issue already. What's your thinking in terms of how long you're going to sort of gather evidence for?
Yeah, thanks, Ruth. Although we were slightly behind, I'm feeling, the programme is feeling quite confident now about the timings of our development of the enhanced registration. So we have tendered and are seeking to contract support to take us through the discovery, because obviously it's an important phase for us to define our exact requirements. I expect us to make the decision post-EU exit, because we want to run the enhanced registration. We want to evaluate it. We want to obviously consult with local authorities about the impact upon them. We want to talk to food businesses about the helpfulness of an upfront advice or signposting to advice, and we're working closely with Julie's team on the new FSA website so that we can actually tie in what we're doing and be consistent in our approach. And I think that's really important. So I don't think it will be a decision we make this side. And to be honest, our legal advice was that might help us move quicker after that, because we would have, if we had to go and seek to do it before we had exited, that would have been a longer piece of consultation we would have had to have done. So we'll pick up some pace with that.
Can I just come in on that, though? I do think it's really important that we continue to say that our intention, our position is that we expect a permit to trade to be the right outcome.
Yeah.
Because once we've stopped saying that, then it stops being part of our position. And we can subsequently say, actually, we've now achieved so much that we can believe that that's not necessary, but I still think we need to keep that there. And I think we keep returning to this at the board, that still is our position. A permit to trade is, if we were starting from scratch with a blank piece of paper, that's what we would start with, and that's really what we must hold in our minds.
And that's the line we're holding, completely support that. That's the line we'll be holding in the local authority events that we're doing, because they too feel quite strongly that would add something very important to a new system. So we're sort of trying to work in the ethos of it's what we want, and we're going to prove why we want it. So that's the place we are.
Dave.
2 points, if I may. First one, in 412, we refer to the variation between BRC and local authority protocols and audits, and just wondered if there's scope as part of this work to try and bring those closer together, actually, because I'm sure industry would welcome fewer audits, but of more depth and value, and therefore we could get support from BRC for that, and hopefully if we can do that in a positive way, we can ensure that consumers and local authorities, who are probably the most cautious about third-party assurance, that this can be a positive thing. And the second point relates to 414, where we talk about our digital capability, and I just would like, I guess, some assurance that we feel our digital implementation will be in line with our operational implementation, so that we're not ready to go with the new system waiting for digital to catch up with us, because systems can take a while to develop.
Okay, I'll take the first one there. Absolutely, our intention is to work with third-party bodies so that the work that they do is going to meet the standards that we set and therefore provide a really important part of the accreditation process, because that's what we want to do. So if people are using schemes, we want them to actually demonstrate a part of our standards that means we can take it into account, and that's the work that we're doing, and that will really take off as we go forward in the lead with the FSA's in the lead for the Codex work on third-party assurance internationally. So that's exactly where we're going with that, and we've got really good response, I think, from interested third-party bodies that really want to get into this space and do this work with us. So an important part of the work, and one that's really going well.
As it happens, Jason and I are meeting with BRC and with the technical directors of some of the biggest food retailers and food service companies to talk about this as well tomorrow. So it's firmly on the agenda. Julie.
Just picking up on the digital capability, we are building the in-house capability, and one of their priorities for this year is the development of the new external-facing website. That will be directly delivering some early capability to the programme, and it provides the advice and guidance service. So we are already delivering, and we need to have a better understanding, I think, of what the requirements are so we can better gear up and get exactly the right resources that we need. So that capability is being developed in parallel with the programme.
Paul.
Thank you. I think this is a really important piece of work, and it's a very full report you've given us. And in particular, when I look at Annex 2 for the programme plan, there's a lot of detail there on what we're actually going to do. And to be honest, as a board member, I don't need that much detail. And what I kind of would like is something that has some of the key triggers along the way, so that I know in the future, okay, yes, that was something that needed to happen, and it was supposed to happen then, and we hit it then. And I wonder if we could have something as a board that was a bit simpler to track progress of something that I think is an important project.
Paul, to answer that, we're going to transition towards outcome-based reporting. So we're looking at the endpoint and then what the key milestones are that are taken on together will contribute to the realisation of that outcome, and that will be happening over the next few months. We've just resourced the team up to do that with that special skill, and as the greater clarity is emerging around the model, and also we're bringing in third-party suppliers to help us in the digital space, we'll be able to move much quicker and give you greater clarity around the key steps as we go along the path. Okay.
Ram, then Stuart, then Rosie.
Yeah, again, 4.2 and 4.14, my comments relate to SMEs and micro businesses. In 4.2, where you mentioned representatives from business and regulators, again, will small businesses be represented in that sector? And then in 4.14, it was very good to see the intention to include the small and medium-sized businesses. I'm conscious that resource will always be a constraint. So one of the techniques we used in the Better Regulation Task Force all those years ago was to actually ride on the back of conferences and seminars that were being organized for small businesses and seeking a slot there by way of getting any information or stakeholder consultation or surveys or whatever. So I just throw that as an idea. And I'm sure it may be that you already got that in place, but there are a lot of those things going on, and I just put that in the pot. Thank you.
Yeah, it's a very good idea, and I'm happy to say that my colleagues already thought of it. So they're working with BEIS and their engagement to try and be as joined up across government as we can, not least because there's a programme of work led by Cabinet Office about regulatory reform, and we're trying to be as coordinated as we can as we touch and engage with as many of our stakeholders as we can. And we're also working through trade associations where possible So yeah, so we're doing that. We can update you on that.
Yeah, I've seen the list of some of the trade associations, and that was part of the idea of the wider groups. And the final point, the devolved nations, again, representation to make sure that they too are being drawn into the consultations. I'm sure they are, but I just make the point to belts and braces. Thank you.
Thank you.
416, the stakeholder engagement plan. Some of us have asked that we are able to take a greater interest in these groups and attend some of these meetings to see whether we can get a better understanding and indeed see if we can help. Forgive me, but I'm just a little bit confused now as to how many of those groups there are and where you want more help. I know Rosie and I are engaged in, well, I think you're doing the SME one.
Only in as much as I give information input to the executive, yeah.
And Rosie and I have been involved in a couple. And for example, it would have been easier for me to attend the York LA one than Rosie, but I don't think I knew about it unless I've missed it. So I just could do with a little bit of clarity as to how many groups we've got, when they're meeting, and whether we could help any more.
We did go through a process of board members identifying where they might get connected. I think there's the geography, but there's also avoiding duplication, because it's quite important that we spread our resources wisely. We've got people already involved in meet and local authorities, in the big business element, the SME side, but I think we'll just try and smooth that a little without making this into an industry of its own. Rosie.
A brief comment, actually, and it's around the section 4.2, so it's all about new businesses and where the FSA will sit when it becomes the signposter for information. And I think that's it's slightly hidden away in here, but as it mentions in the middle paragraph, it says there's loads of advice out there by lots of different organisations, and I'd really like to see the FSA seize this moment to really be the central point for that. And it mentions a new website, and my question is, how are we going to trial this out and pilot it with the uninformed new food businesses, because we don't know who they are yet, and they won't know who they are yet. But it's really just to reinforce, I think it's a great direction, but how are we going to actually make sure it works for those new ones?
We're working very closely with the comms team, because I've got absolute confidence that we're going to have the right products and the right signposting on the new external website. But then there's just a discussion about, like you say, how you raise that service, and it is a really important part of ROF and a really important part of permit to trade is, because we want to get in early with all new food businesses, so that we do signpost them to the right things they need to do, the way they need to get themselves assured, and their FHRS rating. And so I think we have to think about how we're going to do that messaging to new businesses, how we're going to make it so that there's a benefit to them with it. And that's why we're thinking about the wrap-up of FHRS and everything into the final, right, you're ready to go. I don't know if Julie wants to comment.
Sorry.
Oh, Julie.
Yes, absolutely. In the development of the new website, which is where these services will be provided, we are looking under the banner of user testing, but it's before the system is developed to check that it works, but to see whether it would work for whatever user group, such as the SME, such as a new business. So really, we have yet to undertake that sort of recruitment process, but we will be looking for really good representatives of organisations that have recently, so they can remember what they were thinking and how hard it was, and what we're proposing, hopefully to make it better, and hopefully they can see that it would work better for them. But it's difficult to reach out to people who haven't yet decided to set up their business, but we're very mindful that we want to get that really good quality input into what we're developing.
Yeah, and I think the key is trying to extend our reach as far as we possibly can. So we will have a significantly improved website that'll have better signposting to other bits of information, not just FSA produced information, but other information. But then, of course, you've got to get to the people to get them to the FSA website. So part of that is, where do they go now? Where do they go? So if I'm setting a food business up, you know, I'm planning on doing that. I've decided to do that in a month's time. Where do I go now? And do we make sure that they've got the links going the other way, not from us to others, but from others to us? That's really going to be the key piece of this. And I think, if we could get that degree of cohesion and make sure that the FSA profile within those areas that businesses are likely to go to first, representative organisations, local authorities and others, that's going to be the key to get them to the website, because I'm very confident the website will be a significant value to new businesses.
Absolutely, and to build on that, one way of thinking about it is, rather than us sitting there centrally thinking we've got a website, so we've therefore broadcast and told everybody, it's very much to turn it on its head and to put yourself in the mind of somebody who's even thinking about it and taking more of a sort of like a Google search sort of approach. So I don't even have to think that there are websites or all these things. I just stick in my search engine, I want to start a business, what should I do? And then you're starting to get the right hits. So we're absolutely starting to take that completely different way of viewing the problem.
I know Com's waiting, but it's Ruth wants to come in on this point.
Yes, just to add that there's quite an industry and capacity of business support advisors, both funded through local government, European funding, all sorts of different sources, and chambers of commerce, in thinking about how to get to the target audience, giving it almost a crib sheet to somebody who's advising on a food business to make it absolutely easy for them to signpost the key things that person needs to know about would be really helpful, I think, and you would get to the people who are looking for help, but not from a food regulation point of view, but just how to set up a business. So there may be intermediaries who you need to target in information support that will actually get to the end point quicker.
Colin.
Sorry, Chair, just a small point on the devolution in the devolved countries, and while it's absolutely essential that we do have a level of flexibility, I'm curious as to whether how do we assure ourselves we don't go too far and incur additional unnecessary costs by putting too much flexibility in place?
I think at the moment, we want to stay core to the model that we're developing, and we haven't introduced any flexibilities. If at the point we get that request, that somebody really couldn't go with us, I think it will be for us to look at and to make a decision about what that means. So if you weren't to allow or recognise the excellent work that many food businesses do privately with their own audit and assurance companies, and insist yet they might have to pay over here for something else because we know there's a costing coming into the model, sustainable funding, then that would be very hard to float with businesses and even about a future regulatory model that's sustainable. So I think when we're sticking with our thinking in terms of this is the model that we've got, and we're being open in our thinking, and it will be interesting to see how far we get till we reach that sort of challenge, and we obviously would bring that to the board, those sort of issues.
We talked when we last discussed this at the full board meeting about getting to the summer and pulling together all the strands into a next stage summary document, still in the sense of this is still a direction of travel rather than we're utterly committing to something now that we say is not going to be fully implemented until 2020. But I think we've made good progress. Some of this content we'll see in that as well. So I think being able to crystallise where we've got to in that document this summer, and I'm hopeful we'll be able to do it in the course of July, gives us a next sort of good testing ground for that comment to come in formally, as well as through the kind of the deliberative sessions that we're having. And that might also be a point to see the pushback that might be on the point that you raised, Colin. I think I've run out of people on my list. Is there anybody else wanting to make an input on this? No, well, just reiterate where we began. there might have been a moment on this where we weren't quite sure a lot was happening. I think we can see that a great deal. It's too much happening now. No, it's a great deal happening, and I think also the way in which clearly the resources have been allocated across the agency to put some power into this is really welcome as well. So, thank you very much. Next item. So, thank you, Lee. Thank you for making it. I hope you didn't have to run from the station. We're now going to welcome to the table, we've got Adrienne Galt, who's our Head of People and OD, and Sean. Are you coming to sit here, Sean? Come on. It's a paper Jason's going to present on a progress update. So over to you, Jason.
Yeah, so what we've been reflecting on is trying to get that a sharper distinction between the board meeting in the morning and the business committee meeting in the afternoon, so that the board meeting is very focused on policy and strategy issues, decision making around that, and the business committee is in that excellent, accountable, modern regulator, and part of that accountability element is the executive being accountable to the board about how the business is run, and we discussed it in the margins and the discussion yesterday. So what we're proposing to do is to, as well as have the standard performance report, and we're working on that, as colleagues know, is to bring different elements of the executive business to the business committee, just to offer insight and hopefully assurance about the progress that we're making outside of those areas that are captured within the performance report, which are very, day-to-day frontline widgety type measures. There's other things going on inside the business, and this next item that I'll just talk through is one of those about what are we doing with our people. And that's not something that generally we'd pick up in the performance report, but I think it's important for the board to understand about the range of activities that's going on within the executive sort of work programme, and occasionally have a bit of a deep dive on one or two of these elements to hopefully address some of those issues about how well run is the business, not just on some of the mechanical stuff about hard performance measures and where we're doing with the money. So I just want to talk through, I don't know if we get the slides up on the screen.
Let me help.
Oh, no, that's right. All I can see on my screen is myself, which is slightly off-putting. There we go. There we go. We're up now. So, so as you can see, in terms of, what do we mean by FSA culture, a lot of this you'll be familiar with in terms of your work in other organisations, and what's our mission, what's our vision, and what are our values. We're very clear about our mission in terms of food we can trust and the different aspects and elements of that. We have reset our vision around excellent, accountable, modern regulator, and explored that in more detail, both as an executive team and with Heather, most recently a couple of weeks ago, with the senior leadership team from the organisation. So we're clear about being able to explain in more detail to our people, and we've released and communicated a lot of that through our internal communication routes. So people are clear when we're talking about excellent, accountable, modern regulator, what do we mean by that? And also about developing our work on attitudes and behaviours. So those things that we want to be recognised for both internally and externally. So our openness of approach, our inclusion, our respect and valuing others, those ways of behaving. What's it like to work within the FSA? What's it like to work with the FSA as another organisation? What do we want to be branded and what do we want to be recognised for? Doing a lot of work in terms of articulating that and instilling that within the organisation. I want to talk about just some different elements of that and some work we've been doing. I'm going to talk in more detail about people and managing change, but I'll pick off the other three just to give you a flavour of what we're about. So, in relation to money, we are having a more detailed scrutiny of our expenditure and our forecasting and other aspects of financial control within the executive team, supported by Chris and his team. We are more actively managing, as I said earlier, more actively managing our finances to make sure we recycle funds. It's enabling us to put additional funding in year into our priority areas. So we've already this year before the end of the first quarter, put additional money into our work on EU exit. We've put significant additional money into ROF, which is enabling us to accelerate those activities. We're also looking to get tighter prioritisation within the finance arena. So we have a process now that the executive team are leading on, which is enabling us to challenge and scrutinise and the work that the investment board does. As I'm sure some of you will be aware from previous experiences, when you subject bids for money to a degree of scrutiny, it's surprising how many of them fall away to some extent when you're asking for the business justification and what the outcomes and what's the value add and what does a business case look like. So we are tightening up the investment end as well as the monitoring of expenditure at the back end. And we're also being much clearer about what's our individual and collective accountability as an executive. So, I'm very keen that directors have an increased sense of, and their teams have an increased sense of the accountability that's right to be operated at directorate level, and then the executive are clear about when we're working as a collective on things like prioritisation. So a lot of work going on in the money space to get what I would say would get the basics right. On the performance side, again, we are introducing a new executive report so that we are more closely monitoring some of those areas and aspects of performance that we need to be aware of as an executive team, and including some of the more basic people measures like average working days lost and turnover, and some of those areas that we've not paid particular attention to in the past. So we'll have an executive performance report, again, that needs to complement the performance report that comes to the board and the performance that's managed appropriately at directorate level. So we need that top to bottom sight of performance, but we need the right people looking at the right level of granularity of performance throughout the organisation, up to and including the board and the business committee. And the other thing that we want to do on performance is focus on the full breadth of activity that we've got going on within the organisation. So it will be about how we are managing our people, how we are managing finances, how we are managing the delivery of programmes. And so we've made changes in terms of the governance structures that we've got around the two major programmes in particular, but also on areas that we've talked about today, like surveillance, where we've struggled to get that going over a period of time. And so by formalising it more into a programme and a project type approach, we're getting clearer about how much we're looking to invest in that and how we're going to hold that project to account in terms of its delivery. So we are looking to utilise those project and programme mechanisms to deliver some of the priorities that we've set ourselves, including those areas that we've not traditionally handled in that way, like surveillance. So, and then on stakeholder relationships, well, you'll have had a flavour of the degree of effort that certainly Heather and I are putting into stakeholder relationships, and lots of others within the organisation, it's fair to say. And we've just touched upon in the ROF session about the amount of time and effort that we're going to put into local authority engagement over the coming weeks around regulating our future. So a huge amount of effort going into that space domestically for a variety of reasons, EU exit and ROF being most prominent, but also, as I've mentioned in the meeting, the conscious effort to put more investment into our international presence and international engagement, which I think is both helpful to us in the short term, but particularly helpful to us in the post-2019 scenario. So significant amounts of effort going into that throughout the organisation, but particularly at the minute at a senior level. So to go on in more detail around people and change, which are areas, again, that I'm sure colleagues will be familiar with from experience in this organisation or others. Our annual people survey repeatedly tells us that only 20% of our people think we manage change effectively within the organisation, and that's a repeat performance. So that's 2, 3, 4 years in the making. And I'm not prepared to sort of excuse ourselves on the basis that I've worked in lots of other agencies and departments where the score's pretty much in the same territory. You know, refuse to accept the fact that it'll always be 20% of our people think that we can manage change effectively in the organisation. I think there are ways in which we can seek to improve our performance in those areas. I mentioned earlier you know, the strat chats that we're doing. That's a way of setting some of the context of that as well. That'll help people understand and engage. And I'm very keen that in this area we explain to our people why we're making the change. We tend to focus on the mechanics, which is the change will happen from this date and there'll be this training, and this is what we traditionally neglect, and we're not unique in this, is why we're putting you through this challenge. What's the ambition that why the world will be better when we've made the change than before we've started? And I think that's an area we need to put more focus on, and the strat chats are an opportunity for us to be able to explain in a very personal way, face to face, about why we're making this change. What's the point of doing it? In terms of people and change, we see here in terms of building a highly effective, resilient organisation and leading and managing through continual change. Colin mentioned earlier about some of the ways that we might look to use audit as well as a means of you know, generating and stimulating a more continuous change mentality within the organisation. And it's certainly one of my priorities to build the resilience of the organisation to change, so that we're not continually seeing the extremes of people going through the change curve, or that actually they are going through the change curve in a quicker, more supported way than they perhaps are doing now. Just, you know, changing the culture and the mindset of change is the only constant in the career. So there is very little of my working life that's the same now as it was when I started 37 years ago. And just getting people into the mindset of that's the norm, rather than, you know, what is it this year, and that there's going to be some end to this, because there isn't. So, you know, we've just got to get people into that way of thinking. And again, you know, developing skills and capabilities for the future, you know, building resilience is a component of that. So just in a little bit more detail, I'm not going to pull these out, and you might just be able to see that on the screen because there's a lot of detail. I'll pull out a couple of examples. So in terms of when we say, you know, building a highly effective, resilient organisation, what do we mean by that? These are some of the initiatives that we're taking forward. We've talked in the past with the board on there, just to pull out a couple, about our work on OWOW, and we've mentioned it, our ways of working, moving people onto new contracts, giving people new technology, giving people different options about how they work and the ways in which they work. And also, I mentioned earlier, I think in the Chief Exec update, us wanting to maximise the freedoms and flexibilities that we're increasingly having about how we assess the performance of our people, potentially how we get the mix of reward for our people right. So there's a lot of opportunity for us in there, in working with our people, to say how do we assess their performance and capabilities, how do we get more on the front foot in terms of building for the future, and how do we recognise their performance, not just financially but in other ways as well. And we've got more flexibility within the civil service around that. And also around our internal engagement. I've mentioned it a few times about we're stepping up our director-led engagement, but also trying to build capability throughout the organisation so that people are confident to stand up in front of their people and explain what's going on, why the direction that the organisation is moving, and what are the key elements of that, and what's their role within that movement forward. So lots of work going on in that space, as you can see, and Ed can help us with providing more detail should we need it in terms of questions after. And then in terms of leading and managing through continual change, you'll see maybe a new phrase in there. We've got to complement our ways of working. We've got our ways of managing, and just to keep the sort of consistency of theme there. And again, just making sure that in things like people action, our response to the people survey in terms of our action plans, that we do the link and labelling that needs to be done in terms of you said, we did. And, you know, my experience is you almost can't overplay that. You know, but generally people have to be reminded quite frequently about why we're doing this, because you said this was important, and we're working with you about, you know, making those changes. And again, building those first-line management skills. We've done a lot of work in Carmel's area around this, about following the restructure of field operations, which is more than half the staff in the organisation, significant efforts going on in field operations to upskill and build the capability in terms of management and leadership skills within field operations at that first line middle management tier within field ops, which is critical to us. And lastly, on developing skills and capabilities for the future, we will be undertaking a more systematic approach to talent spotting and talent management within the organisation. There are tools available to us that we've not previously used in that area. Those of you that have got civil service links and a civil service background will recognise the sort of 9-box grid approach that's not been utilised, but we will be utilising now going forward. And also we'll be going in a more systematic way, looking at succession planning, not just where we think the opportunities are for succession planning within the organisation, but using our networks and our knowledge of other organisations and other individuals that might see potential for a future career opportunity within Food Standards Agency. So there are elements of that where we just need to get more systematic and more structured in how we do things and a little bit less ad hoc. So significant amounts of work going on in this area to try and get us from good on the left-hand side, and I think we are reasonably good on the left-hand side, to great on the right-hand side. And as you can see from the amount of detail on this particular side, there's a significant amount of work being put in by the executive team, supported by Ed and others. And lastly, it's a build slide. Look at that. Very good. I'll build it all for you. So this is one of our favourite. Built too far. Built it and then knocks it down. This is really just again putting the relationship between the time and effort we put into our people on the left-hand side and the structure and support that provides in order to enable us to deliver our central pillar of excellent, accountable, modern regulator, but also our key programs of change that we've got on the right-hand side, and just understanding the relationship between those different elements. So happy to take any questions on that, but you can see the scale of challenge that we've set ourselves and the amount of activity we're putting into the people space.
I think, first of all, it's really good for us to have all of this in front of us, and also I think gives the whole board an insight into your leadership style, Jason, which is very useful, and then how we see that embraced with your executive colleagues and the rest of the business. Any questions or input on any of this to Jason? I know a great deal of work has gone on across the whole of the FSA on this, and particularly with Maria and Aid in taking this forward. Stuart.
Really just to congratulate Jason on a very fresh approach, and I think you'll get board support for all of that.
Colin.
No, if I just reiterate that and congratulate Jason and the team on doing that, and just a question, is there anything that the board can do to help you to deliver on this that we're not already doing?
I think what's always useful for the board is to try and bring their external experience and knowledge to the table and to the executive, and it doesn't have to wait to the 4 times a year that we have a meeting. I think if colleagues take the time to reflect on just the last sort of 10 or 15 minutes, think about those businesses or those organisations they've been involved in the past where they've seen particularly good examples about, for example, building resilience and building capability to deliver change within those organisations, then I'd be absolutely delighted to have some of that input, because it's similar to Ram's point on the sustainability measures. It shows how well we're doing against ourselves, but how well are we doing against others, and some of that external benchmarking is really critical. We can do it within the civil service context because we get lots of information on the back of the people survey about how we relate to other departments, where the bit that the board can bring that we don't have easy access is to the other organisations, and whether commercial or other public organisations.
One of the things I really pick up on this, and reinforcing conversation with Jason and others, is I think the board has a couple of things to do. I think the board is a really important part of giving the whole staff team confidence that we back this direction, that we're not going to change direction, that we back the style that's being laid out and the culture and the values that we think will deliver for us, but also that we are confident about embracing change. I think lots of people, we all see this in all different walks of life, change is very unsettling, and people can feel very personally responsible for the consequence of change. And whilst, of course, everybody's got their own responsibility in delivering change, it's a team effort to make it work, and what we don't want is people to feel that they are exposed around change, or that they, in some way, they're having to bear a load that's not right for them to bear. So I think the confidence that the board backs the direction, but also that we know that what we're doing is making some decisions to do things differently, possibly to stop doing some things and start doing other things. And those are not decisions that an individual somewhere inside the FSA has to feel burdened by. Those are decisions that we are taking, whether Jason and the exec are taking them or whether they're board decisions. I think that's a really important part of this, to get people comfortable with being a constantly dynamic organisation in the future. Ram.
Thank you. Again, welcome the fresh thinking. It's clear. It's just a terrific piece of work to see so clearly before us. Just 2 points I'd make. One is when you talk about leading culture change, it's fantastic. But of course, it's a huge task you're undertaking. I know that when I've faced, you said you wanted external perspectives. When I'd faced this issue in a business I'd taken charge of, it was explained to me this way. By an external consultant, he said, and I'm maybe teaching many to suck eggs around the table, but for me it was a revelation and very encouraging. He said, if you try and transfer knowledge, you encounter 1 unit of resistance in a circle. If you try and transfer skills, you will encounter 10 units of resistance. Imagine the bigger circle and ball. You try and shift culture. I can't draw the size of the ball. All right? It's huge. So we recognize the challenge that you're taking on within what you're attempting, and you have certainly mine, and I know the full support of the board. Second point I'd make is one thing I found very helpful, which I was initially skeptical about when it was introduced to me from the public sector, I hasten to add, and businessmen looking at the public sector thinking, what are they talking about? But actually, it really was very powerful. And maybe we've got it, investors in people. Mm. And then ISO 9001, there's certain accreditation standards out there. And I'm not sure what's right or wrong, and I don't know even if it is. But all I know is that when I brought it into an organization as leading, it really did make a huge difference. I just throw those ideas in, and maybe you have them, and maybe you're already got all this paperwork and accreditations, great. But keep building on them is all I would say.
I'll let Maria come in.
Yeah.
Thank you, Ram. Yes, we did look at the investing in people. They have a new programme, and we actually examined it quite closely. We felt that we were not in a good place to try and achieve what we wanted to achieve within that programme. We would be aiming for either their gold or their platinum standard. So yes, we will definitely be having those conversations with them, and we want to get into a place where we can start to aim to achieve that, absolutely.
It'll be a work in progress, I take your point, but if you don't start it and aim for it, we'll never get there.
Chris.
Yeah, just to build on the point about change, I think one of the things that we're trying to do more at Exec is be really clear about the outcomes that we're trying to achieve. So that people can go through the maturity curve in change and not only accept it, but also start to instigate it and then successfully deliver it is the final piece. And if they get a real understanding of what we're trying to achieve, they're better able to prioritise spot areas where we can maybe reduce the resource that we're using and put it into places that help us to achieve the strategy and vision.
That just prompted another thought. In your middle line here on leading and managing through change, at the end you've got recognition and achievement, and I think the board has a role to play in recognition as well. I'm sure it's not what everybody kind of wants, is a gold star from the board is the ultimate sort of goal that they're going for, but I think we are a part of giving people that recognition. Anything else? I know all the exec want gold stars from the board, by the way. I'm quite clear about that. Chart. Door stickers. Anything else at this stage? No, well, thank you very much for sharing that with us, and thank you for all the work that's gone into it. That brings to a close. I don't think there's any other business for the business committee.
Julie has.
Oh, Julie.
Second half.
Oh, you've got the data bit. Oh, well, that's strange. It's not coming up on here. Julie, over to you.
This is, thank you very much. I was so carried away. My opportunity to talk about data. So, yes, we've got a short presentation that hopefully now has come up on the screen. Sian and I want to give the board an illustration of some of the things that we've been doing in data in the last few months. Some of the things we've delivered, some things are work in progress, and some are maybe looking to the future. But before I hand over to Sian, one observation I would say is through the course of the meeting today, data has come up in so many of those conversations, whether we're talking about the MI or whether we were talking about the allergy work. So I'm hoping with these case studies it will be really sort of resonating with you with some of the conversations that you've already had. This afternoon, we're not planning to get really technical. We're planning to give you some stories, some ideas of business problems that we faced and where the data being applied to those problems has delivered some benefits, some greater insight, or some change. So at this point, I shall hand over to Sian to take us through the presentation.
Thank you. I'm hoping that you'll all recognise this slide. It's one that Guy will have shown you before, probably Steve too, and it underpins how we think of data as supporting the organisation. We're going to share those data stories to illustrate work that's going on across the organisation, but we want you to think about how they relate to this data pyramid and why data is important, even when we're looking at information, knowledge and insight and impact, and how we as an organisation get value from that. So the first case study that I'm going to talk about is in relation to allergy. We've already heard today in one of the previous discussions about how people can and do die from allergic reactions. So obviously this is an area where data has a role in making sure that people can take action to keep themselves safe. But the really important point here is that it's about access to the data that they need to make decisions in a timely way that we're looking at. So an early data set that we released as part of the Open Data Programme was looking at incident type and in particular the recalls and withdrawals information that we put on our website. So this slide shows you those withdrawals and recalls of products because of the different issues that have been identified with them, and you can see that allergic reactions, the allergens in the product is a significant component. When we put this information out in quarter 3 in 2016, so the first time we released the data, one of our open data advocates suggested that we might want to make this data available in real time because it's really powerful for people to take action on the back of. So we've been looking at how we might do that and how reliable that data would be. As part of that work, we're developing an API, which is an automated programming interface. That means that when the agency issues an alert, a recall or a withdrawal of a product because the allergen labelling is wrong, people will be able to use that information straight away. So instead of waiting for us to issue something on our website and then looking for that proactively, then updating a separate website, the information finds its way out to all of the people who use it straight away. In fact, the way we're building this is so that our website gets updated at the same time as all of those other organisations who rely on our data. But you can choose. So if you're allergic to peanuts, for example, then you would sign up for any alerts relating to peanuts, but you wouldn't sign up to the ones relating to maybe gluten, which is why I've indicated on this slide there is full choice and you only get the data if you're signed up for it. We've been working already with the organisations that support people with food allergy because it's really important that they're the ones that have the people using their services. So we want to work with them to make sure that this does have the impact that it could have
And one of the people we're working with is the anaphylaxis campaign, and this is what they've said about the work that we're doing in this space. I'm going to move on to the next case study. The second case study is about social media analytics. We obviously, as part of our communications work, monitor and respond to people who engage with us on social media channels. So those would include Facebook, Instagram, Twitter, and a whole range of other channels. But when we need to engage on a specific topic and evaluate what we're doing, we use data through those channels to look at the impact of the work that we're doing and how that plays out on social media. So we do routine monitoring, and we understand really clearly the impact that specific activities have on changes to the baseline social media activity that is going on. At the moment, Facebook is and continues to grow as the biggest platform. It has users that extend to about 1.8 billion people. And although media reports are that younger people have stopped using it, in reality, they haven't stopped using it. They still go there. They just use other things as well. And it is quite improving its representativeness across population groups. So I'm going to come on a little bit more to talk about how we might use that kind of information in the future to supplement some of our other evidence. But first of all, I'm going to spend a few minutes on something that was really surprising that we got from a recent social media study. So working in partnership with academia, we had a postdoctoral researcher that came to the agency from the University of Sheffield and looked at YouTube video content, because young people are using videos as they used to use photographs, but gaining insight from videos is really difficult. So Anne particularly looked for evidence presented in the videos in relation to raw drinking milk, and found that the majority of videos actually didn't contain any evidence. And where there was evidence, it was highly weighted towards opinion rather than scientific facts. Obviously, in our communications, we rely much more on scientific fact. The second thing she found that was really interesting was that authority figures were really important in those videos. So they were in authority, but actually they were in authority in relation to opinion and do what I do rather than scientific fact. There was also a really significant component of exhibitionist videos, people who wanted to be the centre of attention and were using that to encourage people to do the same as them. This is a really different kind of evidence that we haven't really tapped into. So I've included these two slides just to show you that the breadth of information that we can get from social media is really interesting in areas where the agency has a specific interest. I was talking about Facebook, and people who have access to social media is one of the things that might help us get a more balanced evidence base in relation to how people report to behave. So this data comes from the ONS Internet Access Survey, and it's really interesting in the context of Food and You, which I know you've all heard about. So Food and You fails to achieve a representative sample, particularly in young men. The overall response rate for Food and You is just over 50%. In young men, it's much, much lower than that. When you look at this slide, you can see that more than 90% of 16 to 24-year-olds engage with social media channels. So we're looking with UCL to look at bias across all of the different samples, because it might be that supplementing traditional research with social media information in particular demographics can increase the efficacy of the evidence base quite significantly. The other point to note is this survey is a sample of people at a household level. So people go and knock on doors to collect the data. And although the over 65 percentage, it's more than 20%, but not significantly higher. When you look at people using social media channels, the engagement of the over 65s, particularly on Facebook, continues to increase really significantly. We're talking well over 60% now. So that's really important for looking at when we've got specific issues that are relevant to particular population groups, making sure that we're choosing the right channels to engage or to get our evidence.
If I just add at that point, what we're seeing there in that social media is near enough the response of those audiences in real time. You can look and see what people are talking about in real time. And you compare that with something like Food and You, which is every 2 years. So that sort of access and the immediacy, whether it relate to a possible new piece of policy that we may be looking to consult on, or there's a, an emerging incident and seeing how that incident is being talked about across the population. So I think that speed of access to what consumers are talking about is hugely valuable.
The first two examples that I talked about were about us and data centred around the Food Standards Agency. The next example is really one looking at other people's data. So industry are using new tech all the time. And one of the things that we know they're using in quite a big way to monitor temperature control along the supply chain is the Internet of Things. So we're looking at how we might set some standards for Internet of Things type data, particularly in the cold supply chain, so that when organisations are using and collecting that data to manage their processes, the agency actually gets some benefit from that too, whether that be in dealing with recalls or identifying risk areas. And that was picked up in one of the previous discussions too, about not understanding the stability of that temperature control along the supply chain. In this area, we wouldn't want to collect and to manage all of that data. We're talking about billions of data points every single day, and there are organisations that do that really effectively. What we're talking about is, in the event of an incident, having already considered the data standards that we would want to apply to that data so that we could use it to help us be more responsive. And we're working with a company called IMS Evolve, who are the data curators for a significant number of the big retailers in the UK, and how we might work with them to develop those standards so that we are better informed about the way that the industry is using that technology. That's an example, obviously, in emerging tech. There's lots of other examples. We pulled out the Internet of Things because that's one where we've done some work historically, but it would equally apply to things like blockchain, where standards are really important. And if that wasn't technical enough, the next example is the full technical example. So this is, again, in relation to a standard setting piece. In the EU, when we report our analysis of food samples, we have to report it against Food X2, which is a list of food types. There are 40,000 entries in that list. We have to do that, but so do all of the other member states. And it actually would benefit industry, and they've identified this as being a benefit, if they had access to a linked data set, so that if there was a problem with cucumbers, carrots, any particular thing, they could pull back all of their data. We could pull back all of the data relating to that commodity. So these are standards at the nth level, and I'm just going to take you through how this works in relation to sea salt. So you can see on, or you probably can't actually, one of the things on that list is condiments, and if you click through condiments, then salt is one of the options you get to. And in salt, we finally get to sea salt. Each single data item in this list has a unique URL, and that unique URL allows it to be used as linked data. It's available now, and we're working with people who are keen to use this type of data. The idea that it will be public. It is already available publicly. We haven't promoted it until we've tested it a little bit more. This is really to highlight the skills point. We need the skills in the agency to be able to manage this kind of data hierarchy so that we can make full use of it and help others to get the benefits from it. In the EU, in discussions with FSA, they're really keen to have this linked data set because all of the other member states want to translate it into their languages because they think that the original should be in English, because that provides the opportunity for third countries to also map their data onto the linked data set. So we're talking about international standards for food commodities. The final example is one you're probably familiar with, FHRS. This is quite a complicated slide, so I'm going to take a minute to describe it to you. It's a comparison of the FHRS rating with the local authority enforcement monitoring data and the UK FSS, UK Food and Feed Surveillance System data. And it shows that the percentage of unsatisfactory samples, so the ones that fail their tests, is more close. There are more of them in poorly compliant businesses. So where an FHRS score of 0 or 1 in a business, they're more likely to have a failed sample. And this is the data that underpins the effectiveness of FHRS, in that it provides a link between real-world illness being reduced in businesses that are broadly compliant, i.e. they get a 4 or a 5 for FHRS. We think that this, or the evidence suggests that this is because food businesses compete against each other to strive to get a high score. We've got quite a lot of historical evidence that that is the case. What we want to do as the next stage is to start harnessing consumer power. So there isn't very good evidence that it's consumers going into businesses and insisting on a 5 that makes the businesses improve their FHRS rating. But in order for us to achieve this, we need the digital mechanisms of getting the ratings out there. So on this slide, you can see the sticker at the top and the new ways of displaying the rating that we're currently consulting on in Northern Ireland in particular, so the digital displays of FHRS. The intention being that in the future, we would be able to make sure that the availability of the rating for the business is ubiquitous, whether you're looking in the window or whether you're actively looking on your phone, your tablet, your laptop, or indeed your sat-nav or other connected device to decide where to eat.
This is an example where we are going to the consumer, where they are making those decisions as to where to eat. So we need to follow the consumer, and again, not assume they will always want to come to us.
And that ends the case study.
Thank you very much indeed. Very interesting. Questions from board members or comments?
Thank you. Yeah, just a thank you. I'd asked the question right at the beginning of the meeting and hadn't anticipated this amazing presentation. It really illustrates the points being made earlier on in words in a way that words cannot explain, so thank you very much. Excellent.
Rosie.
Yes, just briefly to say I've really enjoyed working, having sort of a bit behind the scenes with Julie and Sean on this, and it's fantastic to see real life examples, which is what we've been talking about. And I suppose the next steps are how you can prioritise these and really pick the areas out of our 300 data sets and find the ways that we can make most use of this, and that's the future, really.
Stuart? Colm?
Yeah, no, excellent presentation. Thank you very much. Just one question from a very early part of the presentation. That was the API for automation. And the way I heard that was we get flash alerts up to users. How do you become a user? How do you get signed up to that?
So that'd be the same way, or a very similar way to the FHRS. You can sign up as an individual and get a Food Standards Agency alert just through a few clicks on the screen, or if you use the service through a third party, because they might add some additional value, you can use it that way too. We're piloting it at the moment. The development work should be complete by the end of the summer, and it should be live by the autumn.
I had, sorry, Jason.
No, you do your point first and I'll finish. I'll do the other way around if you like.
Mine was really minor.
I was just going to say that it was what we were trying to achieve in the slot was we talked about data, previously quite a few times. It's quite a difficult thing sometimes to get your head around. So we wanted to try and bring some real life examples of when we talk about these things conceptually, this is how it might come to life. So it's again part of that sort of chief exec slot going forward of this is some real stuff we're on with inside the organisation to try and help the board understand a bit more.
My point's too minor now to raise it after that high-level summary, so I shall mention it later. Any other inputs? No, right. Well, then I will once again, now I know what the agenda looks like, declare the meeting closed unless somebody tells me I've missed something else off my list. Thank you very much indeed.